Hello, good afternoon, everybody. It's August 27th, and this is the BoCC work session. We're going right into sitting as the Board of Social Services and for the second quarter update. And Lindsay, I saw you there a minute ago. Come on up. Lindsay Maish and staff are here. Action items are second quarter budget expenditures and second quarter payroll expenditures. And hi.
That'll be me.
Yeah, excellent.
All right.
And make sure to identify yourselves just for the recording so the public knows who you are. We don't have subtitles, you know, with people's names on the TV.
I'm going to share before we, and I have an intro. Hang on. I'm just going to run get some water. Great, I'll be right back.
Okay. Famous last words. You better come back, Patty.
You see me running that way, you know I'm out of here.
I'll do an introduction. That'll give you some time. Sound good? Hello, Lindsay Maish, Director of Human Services. Good to see you all. Thank you for having us today. As you know, today we are here because Colorado is a state-supervised, county-administered human services program. The Colorado Department of Human Services is responsible for all activities, all of our mandated activities provided by local and district human services departments, and all of our allocations and expenditures related to those. The state relies on each board of county commissioners in every county in the state of Colorado to serve as the Board of Social Services to oversee our local social services programs. What that essentially means is that what we're mandated to do is have you all oversee and approve our allocations, expenditures, and our budget. In Pickens County, human services functions are primarily performed by us and most of this team and many others. But there are some other mandated services that we offer to Pickens residents that we contract with other either governments or organizations. Those are child support services and long-term care support services. We work with Garfield County on those, and then other mandated services are through IGAs, include our LEAP eligibility, that's the low energy assistance program, eligibility determination, which is provided by Goodwill. And then we also work with Prowers County to answer all of our child and adult protection hotline services. Today, you all are going to be looking at the second quarter of 2024. Our human services program, just as a reminder, they can be a little bit confusing because our allocations follow the state fiscal year, which is July to June. Because of this, the second half of the year usually it will appear that there's a spike in revenue, which is to cover the previous state year's expenditures. The closeout or the payout process for the state fiscal year includes covering costs for 6 months from the previous year, and that's why it can make the calendar year look a little bit funky when we are reporting some of these numbers. What it does not mean is that we're receiving more revenues than we're supposed to. So today, I'm going to hand it over to Stuart Fox, who is our finance person, to go over all the expenditures.
Thank you, Stuart.
Wonderful. As mentioned, my name is Stuart Fox. I'm the financial analyst for Human Services. I'm going to attempt to be very succinct as there's not a lot of things that we need to bring to your attention. So the first thing I'd like to note is just under total programs, you'll notice on the right-hand side, percent used. That's comparing what we've brought in revenue or what we spent in expenditures, comparing that to where we should be compared to the end of this quarter, which is we're through 50% of the year. As you'll see, we've received 45% of our budgeted revenue, and we've spent 47% of our expenditures. So pretty on line for where we expect to be. The other item I wanted to share with you, and there is an error, unfortunately, in our write-up where it says child support services. That should say child welfare. My apologies on that oversight. But highlighting child welfare, you'll notice we've received 44% of revenue and spent 60% of expenditures. Compared that to the same time period last year, and it's much higher, both in terms of revenue and expenditures. The reasoning behind that is we have two very complicated child welfare cases that are using a lot of staff's time, and because they're spending their time, they're also able to draw down that allocation. And so those are the two items I really wanted to note here in the expenditures.
Any questions?
No, keep going.
No, do you need a vote?
Oh, you need a vote on that?
I'll make a motion to approve the 2024 second quarter expenditures.
I'll second.
All in favor?
Aye.
Aye. Okay, now we keep going.
She got back just in time.
All right, now I'm going to hand this over to Norma to talk about the Economic Assistance Direct Services payrolls.
Hi, Norma.
Hello, this is Norma Avila. I'm the Economic Assistance Manager. So as we can see the program payrolls for the second quarter 2024 on the A&D program, it was low due to a low income and resources for eligibility. And the A&D grant is $248 per month if a client qualifies for it. The resources limit is $2,000 for a single person and $3,000 for a couple. So on that, we're kind of low for the second quarter. We can see the child care assistance. There is an increase on the second quarter due to families returning to work post to COVID, and also the rule that it was removed last year for 2023 regarding child support. The OAP pension has been steady for the last 3 years, and that has been the same. The LEAP program, the open enrollment is from November through all the way to April. Last year on the second quarter, they extended that program into June 2023 due to there was sources still available. But this year, it was done on April 2024. So that closed the open enrollment. We will reopen it again on November of this year and move forward with LEAP. Colorado Works has been higher on the second quarter due to the increase of staff training and trying to as well to screen the families on their needs. And we have received 12 applications for that. And we've been helping our clients on their needs, for example, to not be evicted from their housing or moving into a new house and needing money for that. So they really appreciate that. SNAP in the second quarter as well has been increased with 21 applications due to the outreach in our community. And the maximum allotment for food assistance is $291 per month per individual.
Could you forward
Kelly.
the slide? Oh, sorry.
Yep. Sorry about
Thank
that.
you.
There you go.
Okay, thank you.
Any questions?
I'm always glad to see more CCAP money going out, so that's good.
It's nice to see that people are going back to work.
And you said with SNAP, do you see it increased due to, increased outreach efforts? Is that what you said?
Yes, of course.
Right, I remember them talking about that previously. I don't have any questions. Anything else?
I'll make a motion.
So do have a question on, looking at the LEAP,
Mm-hmm.
in 2022, we were over 30,000. Now we're down to 2,000. And we have had perhaps warmer winters might be part of it, where people don't need as much
That's a dramatic difference.
help on heating their place throughout the winter. But is there another reason why that is so much less than it was 2 years ago?
So LEAP is one of the ones with the post-COVID that I think we saw more people enroll, more people needed help, and they were still locked in. So I think people were able to utilize the program in a different way because of post-COVID, and not as many people had jobs, and so we just had more usage. You can kind of see that across, like with SNAP, LEAP, some of our bigger ones. The ones that are a little harder to spend are like old age pension because the eligibility requirements are so tough. But some of, like, we look at SNAP and LEAP as ones that are a little bit more fluid. And the state often, I don't remember what happened in 2022, but that could have been the one where they extended also the end date of it so that people were able to access it for longer as well. Not sure this year they did not do that, so we are seeing a smaller usage of that.
Okay.
They're having a party outside and we didn't get invited. I think they're swearing in somebody new.
Oh, nice.
The sheriffs are all out
okay.
there and
Great.
deputies and staff.
They didn't
and
invite us.
Should we jump in the windows
Okay.
and like bomb their photo?
We should all stand in the window and wave.
Oh, yeah, that's true. I know. Excuse me,
Okay,
just
thank you. We had a motion.
I made a motion to
I'll
approve.
second.
And a second. All in favor?
Aye.
Aye.
Thank you.
All right, great, thank you. All right, now we're gonna just go into general, this was the meeting, quarter 2, where we're just giving you sort of general updates about what's going on in our world right now. So I will start with a couple of things happening. We've had some changes in our human services staffing. So we had a departure of the Deputy Director of Programs and Services and had the opportunity over the last year to really look at how we needed that position in our organization to function. So through a lot of support from our consulting company as well as the work of this team right here, we arrived at reclassifying that position into an analyst, a management analyst position. So we are currently hiring for that position. We think we should have an offer out by today. So we're hopeful that we'll be fully staffed here within, not fully staffed. We'll be almost fully staffed in hopefully soon. We are struggling a little bit in our child welfare and adult protection as well as economic services to hire in those departments. The market studies have showed that the hiring ranges for them they're behind. We're a little bit behind in some of those. So we had an offer out for a caseworker, for a bilingual caseworker, and we don't think that that's going to work out. And the response from that person was that it was because the salary was so low. So we are working together with the state of Colorado. We believe HICPUF is looking to hire the minimum wage, which hopefully will influence kind of the way that we look at it as an organization. But we have had some difficulties with hiring just because of the ranges and where we're bringing people in. So wanted to give you all that update that our child welfare right now is understaffed. They're still doing great work, but also Kelly is taking on some cases herself. I think we're doing the best we can, and we're really working as hard as we can to figure out how we can address some of the salary issues.
Sorry, I have a question.
Yeah, go ahead.
Is that Matt's position that
Yeah.
was restructured? Okay.
Yeah.
Is Sam still around?
Yeah.
Okay.
Yeah, he is just getting back from being out for a few weeks.
Sure.
So we're letting him get caught up since
Yeah.
we all did a
All
lot.
people should take their vacation. Do you know, as relative to our local AMIs, what the salary is?
I can get you that information. I don't have it off the top of my head right now, but I know that we're not in line with some of our own benefit programs. And I think that's one of the tensions that the healthcare policy and financing and CDHS are feeling, is that a lot of human services staff have to access benefits because of just the low scaling of the pay, which seems wild because of the amount of risk and responsibility that these positions take on. So I don't have it. I can get it to you though, if you'd like.
Thanks. John wouldn't know, would you?
Not off the top of my head.
Thank you.
Trick question.
Let me just take a note. No. All right, I'll remember that. Okay, so the next piece is around the Schultz HHS building. Oh, yeah, go
Sorry,
ahead.
before you move on, I'm just looking to the latter paragraph of the section in your
Chat.
memo.
Right.
Yes.
Dr.
I want
Fedorowicz.
to honor.
How could I have missed that? Oh, my gosh.
She did
Thank
that
you.
to
I
you.
did-
You
I
knew
did-
she was doing that on purpose.
With great pleasure, we would like to share with you that we now have Dr. Chad Fedorowicz. Yay! Who we all had a watch party and watched him successfully defend his dissertation on spiritual dementia care, a phenomenological study of
Whoa.
spiritual care supports in assisted living for older adults with dementia. So we are so lucky to have this kind of subject matter expertise on our team, but also in this community.
So did he got this because he knew how to spell phenomenological?
You said it.
Helps.
Among
even
other
more
big
important.
words, I'm
Congrats.
sure.
Congratulations, that's quite an achievement
Congrats.
and an honor.
Good for you.
Thank you.
I don't know if I can call you Dr. Chad.
So how long did it take you from when you entered the doctoral
Come
program?
up here, Chad. Come up here.
Thank you. Yeah, you gotta come on up.
Sneak in here.
Now, this is where we get to grill you, right?
This would be easy compared to
Yeah,
my
yeah,
dissertation
sure, no
defense.
doubt.
About 4 years
Yeah, wow.
or so.
Well, great.
Well, one reason I asked, my daughter just entered a doctoral program with a 2-year-old daughter to take care of, and
I did mine quickly
I'm
in 4
curious
years.
how long it will take her.
Usually it's 5 to 6,
Oh, wow.
depending.
That's great.
Well,
Yeah,
congratulations.
you
on
got
that.
that
Thank you, I
quickly. That's
appreciate
great.
it.
Dr. Fedorowicz also holds, is it a monthly gerontology talk, or what is where anyone can come ask you
I
about?
hold bi-monthly kind of open office hours at the senior center for someone to come speak with a gerontologist. So most of the time it's talking about what is a gerontologist. That I'm not a geriatrician, which is a physician. So people come talk to me about their own aging or family members aging or you name it. We talked about exercise one conversation. We talked about mental health support. We talked about, do I have dementia? So it really kind of varies. I just offer.
Do you have any openings?
I'm always open, Greg. It's really just for me to be available if people want to come chat about anything in that regard.
Great, thank you for doing that.
That's amazing. It's really great.
I don't want to throw a wet blanket on this, but somebody, and I saw an article that said that there's a scientist who thinks that they can just make a few cellular changes in the human system that they can extend life to like 1,000 years, in which case your job would be, you wouldn't have a job anymore.
Well, no, because you're going to live 1,000 years. I will have even more job security than I do now.
Oh, maybe
These
so.
old people today, they would be your youth. Right. You'd be working with youth.
But we're all going to get older.
That's all right.
Tell me about it.
If we're lucky.
So now what are we talking about?
That was a great aside, though. Thanks for coming in, Doc.
You're welcome.
Yeah, seriously,
We are,
congratulations.
we're so lucky to have this as a SME, but also it's Dr. Chad.
And the state of
Like, he's-
Colorado's lucky to have.
Yeah, absolutely.
Thank you.
That's way more fun to talk about than salaries.
Gonna be running for governor next, we gotta watch out.
No.
We're
Happy
wondering.
where I
We're
am.
gonna see.
Not crazy. Where are we?
Okay, so the next is the Schultz Health and Human Services building update. So just wanted to give you all kind of an update that there are changes happening at the Schultz building again. As you are aware, Response will be moving their offices to their new shelter and office space in Basalt. there's going to be, our teams are growing with the new child welfare allocation study and the introduction of some more positions. That's changing our landscape in the building, as well as we have learned that withdrawal management and homeless services cannot coexist in the same place. So we're working with assets right now. They have budgeted in the next year to bring, I'm going to say this wrong, so I need to actually look at it. And an owner's representative design professional to facilitate a space plan anticipating the changing needs of the building in the next 5 to 10 years. The assets management department will be budgeting for the plan. I already said that. So just to let you know that is something that's happening. We're looking at it. Considering the partnerships and how we look at this building, honestly, moving forward. We've had some discussions with you all about that, and I think we're still in the midst of that while we're alongside the NEWT, the New Workplace Task Force at Picking County, who's helping to drive some of the decisions about what that might look like. Just a heads up and reminder that we will be holding a neighborhood meeting next week. Hopeful someone can come.
Greg,
calendar
yeah,
for
'cause
that.
I
Okay.
have Northwest Cog, I'll
Maybe
be over.
Steve
Okay.
also.
I think Greg and I were the two who
Oh,
were
perfect.
indicated. We'll
They
I
will
went
be
to
so
the last
excited.
one. Excited to be there,
Yes. We have, over the past few years, had a couple of meetings to engage our neighbors and address some of the concerns, some real concerns that they have as well with fire safety and the safety of the bus stop and some of those things. And we have put some things in place that I believe have been really helpful. The designated smoking area, I think, has made everyone kind of settle a little around people smoking in the neighborhoods, at the bus stop, kind of in different places. And it's being monitored. And then the other thing is that we do have security there now. That's both monitoring the Health and Human Services building as well as making rounds to our senior center as well. Throughout the day, they're there from 7:30 to 5:30. So they're there before we open and after we close, which is really, really good. It's been so helpful to have somebody on site to just respond immediately when there are issues that are coming up. So we think that some of these changes that we've made are really helping to address some of these community or neighborhood concerns, and we're looking forward to having a conversation with the neighborhood again to just see how it's going.
Have you had any indication from them on, do they see it working, or do they even know it's been implemented? Or what do you think that we don't know what to expect?
Dare I say no news is good news. I have
Right.
not heard much from the neighborhoods.
we'll
And
have a
usually
chance to
when
hear
it's
what they have
not
to say.
going well, I do hear
Right.
what's happening. So I'm hopeful, but I do want to hear from them in this setting of what has been going well and what has not.
Great. I just wanted to ask about River Park Center, complexity in the use of public health and human services in River Park Center, along with the other. Anything you want to tell us about that, just so we understand?
Yeah, so back to the building, that's part of the building update. We've worked out with public health that some of our team can go work there on, I think, Tuesdays, and then they're there a different day, and we're kind of switching off the office spaces because there's not enough office spaces for all of us to be there all at once at the Health and Human Services building. So I think Tuesdays is one of the big days where we're all in the office at the same time, so we divide, and we have some of our team down at River Park Center, and then they switch. We have days where they're in our offices and we're in their offices. So does that answer your question?
Yeah, and then
Okay.
getting along with the neighbors, I'm just wondering, it's more internal, space issues rather than, I took that to read something about maybe there were complexities with
River
the
Park?
neighbors. River Park Center.
Yeah.
I haven't heard
Am I thinking
anything
of the wrong
there. Yeah, I haven't heard anything at our River Park centers.
Got it.
Those two things
good.
are separate, the neighborhood from the
Far enough.
building stuff.
Okay.
Yeah.
All right. That's what for some reason, I was wondering if there was a neighbor issue down there. Okay, thank you.
Yeah. Any other questions about? Oh, one other thing. I had brought to you all that the homeless shelter was looking at contracting with the Aspen Chapel to do their winter overnight shelter. The Aspen Chapel has not approved them to use that space for the winter, so they will stay at the Human Services building. But in the effort to kind of, so that they're not coexisting with detox, we're working on procedures for how they can use one of our conference rooms for the winter overnight shelter. Yeah.
Francie?
Why was it not going to happen at the chapel?
I am not sure. I think they had to have full board approval and they didn't. That's what I understand right now, but.
So it wasn't anything about the facility or intermingling with Congregationalists or anything like that? It was
I did not hear that, but I can't speak certainly.
You have
on
to
that.
have full board, every member of the board has to agree?
It'd be interesting to know just what the
Yeah, I don't know. I do know historically the space that's used is multi-use. And I think, you know, there have been challenges coordinating the different uses in the past, and it's probably related to that, but we'd have to ask the chapel.
I would like to ask the chapel. Can we
Yeah,
ask
maybe
the
with
chapel?
one of the three, didn't we guys give them 3 TDRs just recently?
Yeah, it'd be nice just to get a follow-up so we know what the issue is. Is that something
they
you
can
can do,
do it.
Lindsay?
Sorry,
or-
that's what I'm doing. I'm
Okay.
actually taking a note right
Oh,
now.
yeah, all
Sorry.
right.
Yeah, so am I hearing that a collective, we want to
We'd
look
love to
into
know
that?
more,
We want to
understand
understand
more.
what's happened. Okay.
Right. If there's an issue, what is it? So we've got
Let
our
me know if you
neighborhood
want any
meeting.
help with that conversation, Lindsay.
I'll work with Janelle and Recovery Resources. I'm sure that they have more insight on why that happened, but if not, I'll let you know. Okay, thank you. Okay, any other questions?
Not there, I don't think. Go ahead.
All right, well, I'm going to hand it over now to Kelly Kirkpatrick to talk about the next part.
Hello there. So, I'm Kelly Kirkpatrick. I manage adult and family services for Pitkin County. We have a few programmatic updates. An important one is for children without placement, and this is a situation that arose unanticipated from the Family First Prevention Services Act. And essentially what is happening, we've talked a little bit about this before, is that some, across the county, across the state rather, there are children that require a higher level of placement that is actually unavailable. And so what is often happening is that those children are ordered into the department's custody, and then caseworkers are essentially supervising these children 24/7. We're trying to get ahead of that. We haven't had any of these situations come up yet, but we have seen some concerning trends in that direction. So we've been reaching out to other counties to see what their policies are. Some of the things I didn't think about that I'm glad we've reached out and looked into is agreements with medical staff to administer medications when needed, agreements with safety personnel to support safety of both children and staff. And it generally requires at least 2 staff members, 24/7 supervision, usually in like a conjoining hotel room. Some counties have a space set up in their Department of Human Services building, but we don't quite have capacity for that, so we'd be looking at a hotel room situation. We're also working with other counties to try to potentially fund a therapeutic foster home, whether it's needed in the moment or not, so that whenever a child comes in that needs this level of care, we would at least have somewhere for them to go. More will come on that, certainly. This is a big concern of ours because we're a small team. 2 staff is half of us, essentially, and it would be difficult to carry on normal operations, having 2 staff 24/7 rotating out of a hotel room for one family. Any questions or thoughts there?
You're anticipating that this could be, it's not a problem yet, but you're trying to be prepared for it.
Yes,
correct?
it's it really could happen at any time. We might not have a sort of head start on that, so we're just trying to plan for the event that it does happen.
I have a question.
Kelly.
Where does the Families First Act envision they would be placed?
In a qualified residential treatment placement, which is great in theory, but what's required to become a QRTP is quite high, and most of the facilities couldn't meet that criteria. And so a lot of them closed down. So there are significant wait times for children to find beds in
Where
Colorado.
are the regulated facilities now?
They're mostly in Denver. I'm not entirely sure if we have one on the western slope. I could find out.
So the state established a new criteria, and what it did was then provide a way for us not to be able to meet that new criteria.
It was an
It's a-
unintended.
Unintended
It's
fallout.
federal legislation, right? Families First, wasn't that?
Is that coming
Federal.
from the feds?
I don't know if that was federal. I have to look.
Thought it
Was
was.
that a federal?
I believe it was,
Yeah. Okay.
but I'd have to check to be sure.
Yeah. It probably was. In California, they had FFPSA there, and it was already implemented. And we had just started, when I started implementing this legislation. But the unintended consequence was that the requirements to be a QRTP, none of the residentials could meet that requirement. So we watched like maybe 15 different facilities close down like that, and we had some on the western slope, and now we don't. I think we might have one in La Plata County. There might be one down in the southwest. But yeah,
Yeah, there is.
yeah.
Send them to the White House.
Oh man,
Poor kids.
these poor kids. Yeah.
I know it's really tough. It's a tough situation to begin with, let alone making it even tougher on the
Okay.
kids.
Regarding the falsification policy, are you going to talk about that, or is that?
Yes, I will.
Okay, go ahead.
And I'll move on to foster care diligent recruitment plan if there are no more questions.
Oh, we're just gonna do the falsification.
Oh, we just
No,
want to do
whichever.
that.
Yeah. mhm,
Oh,
yeah.
great. Okay, so over the past couple of years, there have been some pretty public cases of caseworkers falsifying information that gets put into the Trails database system across the state. None of that has happened in Pitkin County, that I'm aware of.
But I am either.
And we're required to submit to the state by September 1st a plan outlining how we would monitor potential falsification and then the steps that would be taken afterwards. One kind of positive from this legislation is that it makes it so that caseworkers who have falsified records in another county can't be hired by another county.
We'll be bringing that policy to you once it's crafted, so you all can approve it as well. Just wanted to give you
great.
the heads up.
Thank you.
All right, ready?
Do people do this to like impugn their parents?
Oh, no, I think, my understanding is usually what happens, and especially because it's in larger counties where the caseloads are so large, caseworkers get stressed out. They're really struggling to meet the requirements put forth just because the workloads are so heavy, and so it's more of a desperate measure.
Expedience,
Yeah,
right.
that is one of the reasons that we've really implemented trauma-informed workplace practices here, so that caseworkers here know that if they're ever in that situation, it's better to come and let us know. We'll talk through it. We'll have another caseworker go out. I can go out if we have to, kind of as is happening here recently.
Thank you.
So it's either falsified to get
To close cases or
out of the system or sent to a different, higher level of system. We don't know.
You know, there are a lot of rules in child welfare and economic services, and I think to meet our our guided rules and timeliness and all of that kind of stuff, I think that pressure can get really, really tough sometimes. For
I've heard
folks.
of it
Yeah.
happening, not here, but elsewhere.
Yeah. Mhm.
Yep, okay.
Any other questions?
No, let's keep going.
We're going to talk about CCAP. We're excited, actually, about this one.
We are
Go
excited.
ahead. Yeah.
The CCAP county rate plan, it's every 2 years, the Department of Early Childhood require a plan that the county needs to give them regarding CCAP. The federal poverty level right now for CCAP here is 265%. And right now, Pitkin County is around 550% of federal poverty level, according to the living wage from Massachusetts Institute of Technology, MIT. The division has been working closely with the state regarding the federal poverty level, and right now they have been raised the federal poverty level to 300. So that is great news. and we will be able to expand our program more. And hopefully we will be having from 10 to 10 or 15 families more in our program. So we will be able to use our funds. Also, before we don't used to use our activity registrations, our parent fees, and we will used to pay only 3 to 4 days of absence or holiday stayed. Now with the new plan, we implemented that it got approved that we're going to pay 10 days of absent a holiday, and also paying $150 for activity fees per family and $300 of registration per family. So that has been approved as well. So we want to use those allocations to our families and put it to our community.
As you know, we haven't been able to spend our CCAP allocation over the last few years, so we're hoping with this raise in the FPL and these opportunities that we'll be able to get back on track with that.
Awesome. Good job.
Go ahead.
Okay, continue. I'm going to talk about a contract that we did on May with the cottage daycare. We use our TANF money allocations to purchase 10 slots for 10 slots for daycare for our children and pay them for summer camp only. So we use $24,999, and this is only for families that they earn less than $75,000, and they were really happy about it that they didn't need it to pay summer camp for their children being at the daycare. So just to let you know that. Also, we have the Aspen Youth Center. This contract, it was used TANF money as well, allocations, and the amount was $49,999. And this money is to perform the youth support for the whole year. The program coordinator is responsible to helping develop and implement daily programs from Monday to Friday. With these contracts, we are supporting 1,065 children that their federal poverty level is lower than $75,000 per year. And so they're happy going to the youth center after school. So that's great that we give them that opportunity to be there as well.
Great.
And
Good to see that.
Interesting to see so many Carbondale folks in the Aspen Youth Center. Is there a Down Valley program that they go to? Yeah, okay. So it is, they're all coming to the youth center here at the rec center, right? That's where this is happening? Okay. Yep.
All right, we'll move on.
That's great. I think we've had a
That's
big,
really
I just
great.
want to acknowledge we've had a big TANF reserve, you know, that for many, many years of money just sitting there in a state where money just shouldn't sit anywhere, you know. So I think this is really creative, and I'm glad that we've been able to draw that down for this, because after school and summer care is really tricky for a lot of families.
Norma came into this position in February of this year and said, I want to figure out how to help these kids, and found the ways, and is doing the contracts and has been really brave to step into that space. So a lot of the credit goes to Norma for
Well
that
done.
creativity and
great job.
innovation.
Yeah.
Yeah.
Yeah, summer camp is expensive, so that's a big help.
thank you.
All right, we're gonna fly through we have nutrition program. You're gonna,
I can
Doc,
Chad's gonna talk about that a little bit, and then we brought Catherine Sand today as well to talk about the CNP. That's one of our MOUs that we're doing right now. And then we'll be done.
come down to talk about the CMP MOU. JS.
You need a few
Welcome.
more acronyms in your life.
Yeah, we can speak in all acronyms. Okay, I'm Dr. Chad Fedowitz, Manager of Senior Services. That's the first time I get to do that.
Oh, fantastic.
So
An
just really brief
appropriate time,
update.
I might
Yeah,
say.
yeah. Just brief update. Want to share trends with nutrition, where either connect very similar to last year or ahead of last year, as far as the numbers goes. So far, or through the second quarter, we saw 100 brand new clients, and those are 100 100 new people that we've never been in touch with in a more formal sense with nutrition. And just one example of that, in the month of June, we had 36 new people come. So more people came in the month than there were days, which we were really excited about. My chef and my team view is to serve at least 10,000 meals this year. The only 2 times in the 50 plus years of our department is the 2 COVID years did we ever serve those many meals. And so if the trend continues, with which we anticipate, for a number of reasons, we will either meet or exceed the expectation, which I think points to the growing older adult population. And we're probably the best place to get lunch in all of Pickens County. And the word is getting out. So we're really excited that we're serving more people. Our quality of the food is really high, and the quality of our other services and programs remains excellent, while we continue to see how we can improve.
Wow, that's how many meals I think I cooked when my kids were living at home.
There you go.
Kelly can relate to that. That's really incredible. Thank you.
Yeah,
That's really incredible.
that's all I have.
That's great, thanks.
Thank you.
Got to go over and hit that restaurant.
All right, so one of the MOUs that we have just completed was for the Collaborative Management Program with one of our favorites, Catherine Sand, and the Aspen Family Connections.
Can I just
Yeah.
say something before you move on? I
Yeah.
do want to acknowledge, though, that to me, there is an optic of, as this community serves more high-end clientele, we are pushing need onto social services that we provide via, in this case, lunch at the senior center. It's just, I don't know if they're connected. I guess there's some connection that's reasonably drawn, but
What do you mean? You mean as prices in town get so high, you can't go to lunch anywhere except there for
Yeah.
some people? Like, that's probably includes a lot of us.
yeah. Anyway, thank you.
Thank you for naming that.
Yeah.
We feel that in our department,
Yes,
for sure.
no doubt.
Yeah. All right, Catherine, take it away.
And so nice to see you, Catherine.
It's so nice to be here. Thank
Yeah,
you very
thanks
much.
for coming
Thank you
in.
to Lindsay and to Kelly and the team for inviting me. I'm kind of Pickens County sidekick. I'm here. I'm Catherine Sand. I'm the director of Aspen Family Connections, but I'm really here today because I coordinate the Pickens County Collaborative Management Program, CMP, which is one of, I would say, the least sort of public-facing of our programs, but probably, I'd guardedly say, one of our most impactful in terms of how we serve higher needs youth and family in our county. And in terms of the values that underpin that program, and I'll talk a bit more about that, but I think this is a place where Pickens County can really pride itself on the sort of degree of collaborative energy and thought and planning and commitment led by Lindsay and her department, because you are the holders of this program, the fiscal agents of this program, and then going right through the program from case managers who actually work with kids and families sort of day to day, but also all our partner organizations. I'll talk a bit more about that in a second. But anyway, I'm pleased to be able to talk about it because I never get to talk about it. So this is, I won't read this through, but essentially the Collaborative Management Program is a program of the Colorado Department of Human Services. And it's this fantastically, I think, facilitative and generous program that allows us to meet with children, youth, and families, excuse me, and determine ways in which we can serve them together in this community. And in Pickens County, we do that in a very preventive way. I think prevention is, we're fortunate not to have too many high acuity situations, but although we have plenty for ourselves, but obviously we're a small county, so the numbers we serve are smaller, but compared, for example, to Denver and larger counties, even compared to Garfield. However, I think we serve them really, really well, and we operate this program with fidelity and commitment. There is an oversight group which oversees this great program, and which is now, I think we're in our 9th or 10th year actually of existence, and these are the current members. There are 11 mandated members, and that includes the court system, schools, mental health. But then we also have a number of additional members. So, Kids First is a member, the Mountain Family Health Centers, Great Expectations, Hope Center. So we're adding all the time. We also have a family representative, and that is a feather in our cap. It's very important for us to have somebody there to sort of be the voice of families, so we don't sit around and talk in acronyms all the time, although we tend to do that. And it's a great group, and it meets 6 times a year. So the CMP program serves multi-agency involved children and youth with 4 ISSTs. They're called Individualized Service and Support Teams, but we call them family meetings because that's essentially what they are. Every family that enters the program is provided with a team. We curate those teams according to the needs of the family, and we run them in several different venues. So some of those are run through Department of Human Services with their family engagement meeting coordinator. Some of them are early childhood focused. That's a new addition that we've started doing at AFC in the last 3 years. We have AFC meetings, which are essentially school-based. They're not entirely, but they're mostly school-based meetings. And then we run Youth Zone holds services and assessment meetings for kids involved in juvenile justice. We also have one prevention program that's listed in our MOU. We're going to be adding to those. And the buddy program, the essence of the CMP is that you need 2 partner agencies involved. So the buddy program funds an incredibly generous and exceptional outdoor leadership program. They do it throughout the valley, but they do it in Aspen Middle School. So about, I think last year we had 16 kids in that program. And it's a co-managed program between the buddy program and the middle school. So it's super successul. So these are our youth served in 2023, and we work on the state fiscal year as well. So we serve an unduplicated number of 99 youth. Of those, some of those were in prevention. We did 84 of those were high needs kids who we served through our family meeting structures. 15 served in this prevention program. Actually, it was 16. There was a duplication. So one of the things I pointed out to our IOG and to you too, this was our highest ever year of duplication. So we had kids who were seen in several different structures, and I think that's a great strength. Basically, we're collaborating really, really well. It means that everybody is getting to work with these families. Yes, but we can go through these, but basically, so 10 of the family engagement meetings were with families who also received collaboration with AFC. So we held, in terms of those actual meetings, 114 of them last year, which I think is quite a lot. They're 90-minute meetings, they're strength-based meetings, and there's follow-up, case management. A lot of support is given to the kids. And I would say also a lot of voice is given to young people. Like, we really, really do not like having family meetings where the young people themselves aren't involved. Obviously, it's a little different when they're in preschool, but particularly for middle school and high school kids, they need to be at the table. They also have things to say, and so we facilitate those meetings in a way that kids can really be part of them, and I think that's sort of critical and a great strength. If you just go back one, so anyway, this gives you an idea of the spread. At AFC, obviously, this is a very major part of our work. It's not our entire work. We served 45 youth. I would say last year we served close to 200 families in total. So not everybody needs to be involved with lots and lots of agencies. And we're not interested in people sort of becoming system involved, whatever that means, for the sake of it. Really, if they have those needs, then we're going to invite other agencies and other organizations to be part of their team. But we're not looking to tie people up in endless services. We want them to, we really focus on, self-sustainability and family self-determination, if you like. We work to set goals with families and with kids. And, we want people to, be out in the world and feel a sense of agency in solving their own problems. So we're not trying to create systems of dependence. And I think that's a value that we share across our, through, it's really led through the system, through DHS. And we're lucky to have this exceptional collaboration. It doesn't exist in every county. I'll just tell you that. My observation is that it's actually quite rare. And when I tell my colleagues in the CMP that we work, super closely with DHS, we almost sort of share offices at times, that they find that incredible. And I think it's a credit to you and a credit to our county that we are able to operate in this way. So, if you could just, these are some general demographics. They're not very interesting, so I'm not going to really sort of point anything out, except there is, I would say, a significant degree of balance. Obviously, we serve more kids in the middle and high school, but I think our effort to try and address younger families through our preschool efforts, if you like, are paying off, because we want to see those families young, right? We want to help them sort things out so that they don't come back to us. What always happens is you see a kid who gets into trouble in high school and somebody says, oh yeah, we knew about him in first grade. And we're like, well, what could we have done, right? So we're trying to do those things. I would say our slightly higher proportion of Latino kids is not and I have to always point this out to you, it's not a reflection of those children and families necessarily needing more support or having higher needs. I think it's because we have bilingual bicultural staff. So people feel really comfortable coming into us at Aspen Family Connections, and I think we're doing a lot to reduce the stigma of asking for help in this county, and that's really a goal of ours. We want people to feel they are welcome. We're not here to judge them. We're going to be super confidential with them, but everyone needs help, right? So a few new things. This is really boring. We did meet all our process measures. The IOG got to tick all its boxes, but we are held to some measures, and we achieved them all last year. We signed our new MOU, in June. We have to do that every year. And we have a new range of outcomes to report on for the state, and they're kind of good. I think they're great, actually. In the past, we had to agree on site outcomes, which makes no sense. I mean, not every kid in school needs to look at their school attendance, for example. So now we can actually create outcomes that match the family's needs, and they might be linkages to services. They might be not re-entering child welfare. They might be completing juvenile justice diversion. It's a whole range of things. And also family satisfaction, which is a new and exciting thing. We get to actually report on how families feel about our process, so that's good. And we're going to meet in October and have a fun session of setting up our outcomes for the year. So there we go. Thank you very much.
I'm so glad you don't use acronyms. But you reference them all, so I can go back and look.
Right.
Try not to.
It's like
I
a
try
game.
not to.
It's a puzzle.
It's like working with the FAA. But
I think this program is
you at
really
least give us a reference, which is very helpful. Thank you.
well. I think this program is a real credit to the county, and I'm proud to coordinate it. It's quite a large proportion of my work, and I love it. And we really work well together. So thank you very much.
Well, thank you for all the good work you do
This is huge.
with us.
That's cool.
And have for so long. Thank you.
Also important to note that we're seeing steady increases in this allocation coming through in this grant. So there is more focused need on this type of care. They're seeing that the outcomes are good and that they're working, and the state is putting some more resource towards them as well.
That's great.
As long as the resources don't outpace the demands put on you by whatever the new.
That's exactly right.
always do.
That's exactly
That's
right.
inevitable. I think Kelly has a question.
I do, yes. And I'm sorry, can you just summarize that resource? Because when I look at this, I'm like, everything is in kind, so I assume that that's staff.
We receive an allocation, I think, of 80. We just got
This
it
year.
last week. 84,000 a year,
Okay.
of which a proportion goes to the county. A proportion is dedicated, and we have to set our budget, but our proportion will be dedicated to direct assistance to families, meaning we can pay for a therapist, or we could pay for someone's snow tires, or whatever the need might be. We could pay for a child's something or other, extracurriculars. I mean, we're lucky in this county, and we're lucky at AFC that we have access to a lot of funding, including funding that I raise for AFC so that we can support families with needs. And then the rest of it goes to supporting my salary. It's a proportion of my salary.
So in this MOU where everything is listed as in kind, are those,
I can
What are-
explain.
yeah, I'm
So
just
what
curious.
all that
Yeah.
represents is the organizations, the member organizations and agencies are required to, everyone is required to make a contribution. And so that money that they put forward represents what they judge to be their contribution to the CMP. And that might be the Hope Center sending their clinicians to attend family meetings. It might be attending IOG meetings. It might be, in your case, in terms of DHS, it's probably staff time allocated to direct work on the CMP. So I don't want to say it's symbolic because it's actually very meaningful, but nobody ever goes through and says, well, what do you mean by that? It's a
Right.
self-declared system.
Okay, thank you.
Good job.
Thank you.
Great, thank you very much.
Thank
Lovely to see
you.
all.
Thank you all for the work
See
you
you.
all do. It's
Yeah.
the work of the angels.
I know, I really love the early intervention.
Mm-hmm.
Because you hear that so much, oh, we knew this was a kid was going to be in trouble, So let's nip it in the bud.
Yeah. Couple other really quickly MOUs just to mention, memorandum of understandings, just so
I know
you
that one.
and
Thank you.
just for situational awareness, a lot of our MOUs in human services often don't have money attached to them. They're just our working expectations and they're called MOUs. So I'm going to reference a couple of these. So the Child Welfare Substance Use Core Services with Rocky Mountain Health Plans. That's one that just switched over from, I believe, Mine Springs had it or West Slope Casa or something, and it now that was RFP'd and now they've taken ownership, Rocky Mountain Health Plans. So we signed an agreement of how we're going to work together when we have kids or families who are involved with any sort of mental health or substance use. We use them in there's a referral process and kind of the way we work together to support those families. And then the other one is between Healthy Families America, which right now is run through Great Expectations, formerly known as the Family Visitor Program. And it's really when we have child welfare, especially like children who are born with child welfare concerns. We're working, they are required, Great Expectations is required to have an MOU through their funding to work with us and have working agreements around how we're going to refer people back and forth, how are we going to communicate and things like that. So just wanted to make sure that you had awareness of those as well, because those are a few of the MOUs that we have, that we've signed and are now part of our working business.
Great, thank you.
Great.
Yeah.
Thanks, Lindsay.
Thanks a lot,
Thanks for
Lindsay.
coming in.
Thank you. Yeah.
Smoothly delivered.
But you forgot to bring the baby. You
Came to
forgot
the picnic.
again.
He was there.
I was at the picnic, thank you.
He weighs 24 pounds. I just learned today, which is a lot of baby.
But it's a happy
I'm
baby.
getting really strong.
Absolutely strong.
Yeah, that's right. But
was
thank
having a
you
great
all.
time.
This is always such a pleasure to present to you all what the going-ons are of human services and to be able to share that with you. So we
Thank you.
appreciate you.
Thanks
Thanks
a
for your
lot.
support.
I just look forward to the time when we speak only, in acronyms.
It's coming. We're close. Yeah.
We have immense gratitude to Human Services and everything that you do.
Thank
So
you.
I was just sitting here seeing you, Lindsay, and Jordana in the back, and that used to be Nan Sundin doing both of those jobs.
Yeah.
And Nan Sundin, I just sold her house in Carbondale, and they're moving to Washington State. I don't know if all of you had
Really?
heard
So
that.
correction, she's not moving to Washington
Well,
State.
they are
She's going
traveling
to
to
stay
visit
there.
her
Yeah,
brother
they're gonna
there.
go visit
I don't know
there.
if they
She's
know
gonna
where
stay
they're
there,
gonna
what?
land exactly.
She's staying there for a while, but she will be coming back.
We
Yeah.
gotta have the trumpet at the
Who's gonna?
Memorial
who's gonna
Day
play?
and
Yeah.
Labor Day or Veterans Day.
Mm-hmm. Yep.
Her husband comes
Yeah.
and plays, he's so awesome.
Yep. That's right.
Well, thank you. Speaking of Jordana,
I'm going to move to adjourn the Board of Social Services.
I'll second.
all in favor?
Aye.
Aye.
Thank you, Kelly, for remembering that.
Okay. Thanks for coming in.
Thank
Thank you all.
you.
Great to see you.
Thank you so much.
Where in Washington?
Now the turkey
Well,
sandwich
her
is starting to
brother's
kick
in
in.
Anacortes.
Oh, wow, neat.
So that's where
Great
they
spot.
went
Charlotte, never.
out to
Roast
visit
beef.
and
Yeah, tuna salad.
Yeah, it's a great
I'm just tired. I have not been going to bed. I have terrible sleep hygiene lately.
I'm sorry.
just visit.
That's all right. I just have too much to do. It's like those hours between when my kids go to bed and midnight. It's short.
Run to the bathroom.
So we're going to take a 5-minute break and we'll come back to it. And we're going to pick up half an hour. Jordana, this is going to be really quick. Okay, welcome back. This is the work session, and up next we've got Jordana talking about the CDPHE main task order contract and new MOUs.
Precisely.
and you brought the entire army,
Not even the entire team.
some of the team.
Some of the team to help talk about some of these different task orders and plans. So for the sake of time, I will let everyone introduce themselves when they get to their section.
Excellent, that's
with
great.
their role.
And we know who a lot of you
And
people
yes,
are.
you know, and we'll get to know some of our newer team members. So we move on to the next slide. I'll introduce myself, Jordana Sabella, the Public Health Director. We are here today because with CDPHE, Colorado Department of Public Health and Environment, we have a main task order contract with them. It goes for a 5-year period, and it lets them purchase public health and environmental health services from Pitkin County Public Health for us to be able to provide those services through task orders that fall under this main task order contract. These task orders are able to be signed by the board chair. That is the delegated responsibility for that. So your board chair has been signing these for you throughout the year, and we wanted to come and share with the board what has been signed and the types of work that get done under this main contract and task order. So we will be talking about 6 different task orders today, and then also a couple MOUs that are in the works that we wanted y'all to be aware of. So I'll go to the next slide, and I will be talking about the Core Public Health Services Task Order. Ariel Holstein typically does the work under this contract, but wasn't able to be here today, so I will attempt to do this for you. So the funding we get for this task order supports our capacity to participate in assessment and planning efforts. We get about $118,000 for a state fiscal year period for this, and we use it to perform the CHAPS process, the Colorado Public Health Assessment and Planning System. So every 5 years, you're probably familiar with this by now. We've been through about 3 cycles. We do a community health assessment. So we gather qualitative and quantitative data. We figure out what some of the strengths are and some of the biggest health challenges are for the community. And then we work to select priorities and which areas we're going to work on to improve health for the community according to this process. All of these documents are available on the website, and our current FIP, Public Health Improvement Plan, brings us through 2027. If you look at the next slide, you'll see the 2 priorities that are selected for this current cycle are pathways to care, including mental health, as well as climate change and health. And so every year, Ariel does a really great kind of report overview and infographic on what has been accomplished, and sends that out to partners and puts it on the website. And then we always work to update the strategies and tasks that will be performed in the following year. That, I think, is it for our first task order. If there's no questions, I'm going to turn it
Move
over
it right along. Hey, Kurt. Hey,
to
Carly.
Carly and Kurt.
Tag team. I'm going to talk about the immunization and a little bit about the ELC task orders, but we will go ahead and start with the immunization overview. Next slide. Thank you. So the immunization task order, we have had this one for quite a few years at this point. And the overarching goal of this grant is to increase routine immunization uptake throughout Pitkin County. It also helps cover a lot of our respiratory illness vaccines as well, including influenza and COVID-19. We work really closely with community health services in order to provide those nursing services in order to actually administer those immunizations, which works on that implement core immunization services. And they are really critical for that process. So they are the ones actually taking those appointments and administering those vaccines. We also use this funding to work on education and promoting vaccination uptake. And so not just, again, of our seasonal illnesses, but also for routine immunizations, especially in those school-age children. And finally, to that point, we also look at how to address and identify barriers and our gaps in our immunization rates in order to hopefully bring those immunization rates up to where we need for that herd immunity and that community protection. To that point, next slide, please. Our recent data was actually just updated for our school and university immunization rates. So this is just a quick snapshot of what the Aspen School District preschool immunization rates look for. And so just really want to highlight that across the board, one of our largest populations, one of our largest schools has quite high immunization rates, especially for all of those routine vaccine preventable diseases. But if you look to the right there, especially in that preschool, there was that dip last year in vaccination compliance rates, and that was seen across the board. That wasn't just unique to our county, but that was across the state. There was a really big decline in vaccination uptake, thought to be due to the COVID-19 pandemic and delaying of services for that. But just really want to call out the work that this team has done, that CHS has done, and that those school nurses are working on to bring that compliance rate up to that really excellent level of 98.1%. And so this has gone a long way at increasing that compliance rate, and we've seen that across the board in the county. There's still a few areas that we have gaps, but we are working closely with those community members and partners to try to address those and bring that compliance rate up throughout the county.
Great.
It's just when you say ASD preschool, is that just the cottage? Or is that all the preschools within the school district?
Just the
boundary?
cottage for this one.
Okay.
Yeah, so if you go to this dashboard, I believe it's linked in that slide if anyone is interested, you can go through and select individual, you can either go by school district or you can go by individual classroom functionally, so.
Okay.
All right, and then ELC 2.2. This is another work order that we have had since COVID-19, and this is very much targeting COVID-19 capacity with public health, and that excuse me, this one functionally, vastly majority, pays for my salary as the county epidemiologist, or at least in part for my salary, and also allows us to continue to have that expanded capacity to respond to any potential changes in COVID-19. That includes targeted contact tracing and case investigations. So this is a little bit different than last year when we presented this. Last year, we were still very much doing broad case investigations and contact tracing. It has shifted in focus from the CDC, from the federal government, and CDPHE, the state public health department. So now we are really focusing at our highest risk and reserving that space for those highest risk individuals, including outbreak response, focusing on health equity, making sure that that message for that preventative measures get out in an equitable manner to our community, and also working with some infection preventionists locally at the hospital as well as community health services in general prevention efforts in those settings. Sorry, I'm a little raspy.
Francie, go ahead.
Hi. I'm just wondering, I've been reading in the New York Times, for instance, that people are treating COVID like the common cold. And so I'm wondering if the common cold are the symptoms for people who have originally been vaccinated, or is it true for everybody? Or
so COVID is not like the common cold. It is convenient to lump them all together when we talk about respiratory illness season. This can talk about kind of typically the winter season when individuals are socializing indoors. A lot of different viruses can be circulating. The common cold and the flu continue to be less severe than COVID-19 across the board. Fortunately, vaccination and other medical interventions such as Paxlovid, if anyone's had the great joy of having to go to their physician for treatment options, all of those have reduced the severity of COVID-19, which is fantastic. But COVID-19 continues to push hospitalization rates and severe illness more so than those other infections. So it is.
Are we still seeing people get COVID after they've been vaccinated?
Of course. So vaccinations were never intended to be 100% protective. No vaccination is 100% effective. Vaccination alongside goes a really long way at reducing severity of the illness. So we are still very much encouraging individuals to go seek those seasonal vaccinations. They were just approved last week. They're not in stores yet, so don't make your appointment just now. But they are lining those seasonal vaccines up alongside our influenza vaccinations. And that's really going to get encouraged come that later September, October timeframe. And so while those vaccines will not 100% protect you from getting sick, it will go a long way at reducing the severity of those illnesses, especially for very high-risk individuals. And it can shorten the length of illness and generally protect you from potentially transmitting that virus to those around you. So vaccines can go a long way at protecting in a lot of different fashions, but there is absolutely no way to 100% protect yourself.
Thank
I
you.
know, that's the spiel.
Patty had a question.
I had COVID twice. I had the flu once. The flu knocked my socks off. COVID, just other than a headache, was a piece of cake. But the flu just was, and I had a flu vaccine, which I don't usually do, and I did. And they teased me because they said I had the mild one, and next time they're going to give me the full whammy. I'm like, if you get me back in there, you're going to give it to me. So that being said, I've been hearing from people that the symptoms of COVID now are different. Not so much respiratory, but GI. So nausea, vomiting, diarrhea. Is that what, do you have any info on that?
Because our contact tracing has kind of shifted, right? We're no longer doing every case we get, we're no longer talking to individuals about symptomology. So it is, I want to say this is with the caveat that our data has changed. Anecdotally and from Aspen Valley Hospital, we have heard that there has been shifting symptoms, that people are stating that they are getting those GI upsets, that it is a sore throat, headache. But again, those kind of traditional COVID symptoms where it is predominantly respiratory, especially in severe cases. The reason why individuals are still being hospitalized with severe COVID-19 is for respiratory illness, right?
And I think the duration for the GI symptoms is 24 to 48 hours, where the symptoms related to the respiratory for COVID usually last
It can
a wee
extend.
bit longer.
Yeah, exactly.
Okay, great, thank you.
Yeah, you were so welcome.
Are people getting tested?
No.
That's what I thought.
I should asterisk that. So PCR testing continues to be the most effective way to diagnose COVID-19 definitively. PCR tests are incredibly sensitive. They're very good at detecting positive infections. But that being said, they can be quite expensive, or you're going to be billing your insurance for that, and it requires a doctor's visit. So those antigen tests that you can still buy over the counter, the federal government is reinstating that free testing program for those antigen tests to mailboxes for the general public come winter. Those antigen tests are still fantastic at identifying positive COVID-19, but it is possible for them to give you a false negative. We know that viral load required to ping a positive on those antigen tests can be quite high. And so if you test right when you start feeling ill, or if you think you've been exposed and you're not feeling symptoms yet, sometimes they'll give you a false negative, thus potentially allowing you or making you make a choice about your socialization and your risk factors. So if you are at risk and you're seeking treatment, we always recommend a PCR test or to speak with your physician, which is going to be your pathway to that treatment regardless. Those antigen tests are really, really great to use if you know that you've had COVID. You can test twice over 24 hours to determine if you are still transmitting that virus, if you're still like coughing up and that virus is still present. So if you're going to give that virus to somebody, that's what those antigen tests are great for. But realistically, our big take-home message is that if you do not feel good, please stay home. It doesn't matter if it's the flu, to your point, right? We know the flu can be bad. We know that COVID can be bad. If you feel ill, one of the best things you can do, not just for yourself, but also for those around you, is to continue to self-isolate until about 24 to 48 hours after symptoms start to improve, especially a fever and especially a cough. So if you have that fever, you have that cough, stay home, get yourself feeling better, wear a mask if you absolutely have to be out in public. But otherwise, take care of yourself, take care of those around you. Just stay home if you're sick.
Great, thank you.
Good advice. Thank you.
Yeah.
This is me. Raleigh Backrock. I am the PACT administrator. And I'm going to be providing an overview of our harm reduction task order. So before I jump into the slides, harm reduction, quick definition for you all. Harm reduction refers to reducing one's risk when using alcohol and or other substances. So harm reduction, that can be in terms of not using, using less, or employing other strategies that may help reduce one's risk when using. So this project and the goals for this funding are to reduce the negative health effects of drug use, improve communication between Pickens County Public Health, our 3 law enforcement agencies, and other community partners, and to develop alternatives to the criminal justice system for those who are suffering from a substance use disorder within our community. And so we're achieving this goal or these goals by sustaining and implementing our PACT program. So PACT stands for Pickens Area Co-Responder Teams. That is our local co-responder program where we pair a mental health clinician with our 3 law enforcement agencies for them to respond to calls and to divert people in our community with substance use disorders to treatment or other services rather than jail. So for this task order for state fiscal year 2025, we're receiving $314,794 in funding, and then the additional funding stream that we also receive, the secondary funding stream, is through the BHA, and I was recently here for a first and second reading to approve that funding. So combining those two funding streams really helps us sustain and implement PACT.
Well done. Great.
Oh, thank you. And just to provide a little overview, so this slide and the next few slides are taken from our 2023 annual report, which can be found on our website. This really kind of provides an overview of what I've just spoken to about our PACT program. To dive a little deeper, it is just a very strong collaboration between Pickens County Public Health, Mine Springs Health for our clinical side, Aspen PD, Pickens County Sheriff's Office, and Snowmass PD. And beyond kind of the active co-response of having a clinician with our 3 law enforcement agencies, PACT also provides peer support services and case management services. Just diving into some data from 2023, we served 288 unique individuals in 2023. Supporting harm reduction practices related to harm reduction is a core objective for PACT, and substance use reported by PACT clients are highlighted on this slide here. So we had 34% of individuals served by PACT reported to use a substance, where majority of them reported using alcohol. That was the most frequently used substance. I will note here that the team does feel like this 34% is, there's some discrepancies here, and that the 34% is quite low for 2023, and we're working closely with our data platform to figure out just kind of on the back end how it's getting pooled. But we do believe that number is probably much higher.
So people aren't reporting a substance involvement. Then what about the alcohol? Is 88% about, that's probably stays about the same, doesn't it?
So correct. So when we're looking at like the 99 individuals served who reported a substance use issue, what we're seeing is that our team who goes in and provides this data, they seem to be collecting the data appropriately. There is some movement in where this data field was placed, and so it's more of a back-end issue. For the alcohol, we do think if that number, that 34% in general increases, we might see that alcohol percent increase as well. But the team does believe that alcohol is the most frequently used substance amongst our PAC clients.
Steve?
Are the 34% who don't report a substance use issue just in self-denial about it? They say, I don't have a problem, and maybe they don't realize they have a problem, and therefore they don't check that box then.
Right.
65%?
Yeah, so I was going to say more so the 65%. Again, we think that's probably that 34% is higher in terms of people, our clients saying that they are acknowledging they use a substance. I will note that our team does interface with a lot of community members that are in this kind of pre-contemplation phase. So that could be something that we're seeing, right, that they might be in denial. And that's why we work so closely. We have our clinicians and our peer support services. Our peers are, kind of that non-clinical lens that some of our clients feel that they can open up to a little more. Some of them might feel like they can trust the peers in talking about their experiences as the peers have lived experiences, right? So that's one way we try to ensure our clients can really open up. But yeah, I think there's definitely community members and clients that our team sees that might be in denial. You have anything to add?
Ramsey?
Yeah, I have a friend who was smoking pot and basically just lost consciousness and ended up going to the hospital. And I went there, and the doctor there said they see that quite a few times a day from marijuana. Do you see that when you go? Do your people see that when you go on rides? Do you find people who have passed out from smoking
Quite a few
dope?
times a day.
Yeah. Does that coincide with any of your experiences in the field?
I think
I haven't asked, but I can ask my team. I know that there's strong effects of marijuana use amongst youth, and that can be pretty detrimental. The clientele we serve, some are younger folks, but majority are adult population. But knowing the youth brain, so I'm
This was not a
curious.
youth.
That's
And
interesting.
it was
I can
combined with
ask.
alcohol drinking. So I don't know. I mean, both the doctor and the nurse say they see it a lot. And it was interesting. I've never heard that about pot before. And so I was just curious whether you ever, your staff ever gets called to places where that's happened. Or,
I'll ask. I'll do some investigation
great.
and see
Thanks,
what they're
Riley.
seeing. Yeah.
Is it smoking or edibles? Because maybe they just
Smoking.
like chocolate.
but I think they see it with edibles a lot.
People overdose on the infused
Yeah, they see
a
it
lot
with
because
they
it
see
takes
it with
longer to
edibles.
kick in, so they eat more, and then it all kicks in at one time.
But it was interesting that they both spoke to it, both the nurse and the doctor. And
yeah,
just-
that's
I think a lot of what they see is edibles. This particular case was smoking, but
Do you ever, your clinicians ever take blood oxygen level, measurements? Is that a part of the measure when they're doing metrics? Do they track blood oxygen content?
Our clinicians do not. That's really up to law enforcement, working with them closely. So that's why they do that co-response model. And then in terms of, in terms of a M1 or M.5, so in that crisis situation is when we collaborate closely with the Aspen Hope Center, who does
And the
crisis.
Law
now.
enforcement will do blood alcohol, right? But do they do blood ox also? Just some oxygen levels? Just wondering if that's ever part of it.
Do you know that?
I'm not
An
aware
O2
that it
sat?
would be
You know,
part of what
yeah,
they would do. I think you
there's
would
a-
need a medical.
Yeah, I think
It's an O2 saturation.
Yeah, I'm just thinking, a doctor told me that people here in general have much, markedly lower oxygen levels in their blood, which could have an effect on anything else they do. Just wondering. I don't know. I'm just anecdotal because I look at that a lot.
Well, I can check in with our law enforcement partners to
Did
see.
you check your O2 sats?
I
all
do.
the
I
time?
check and say no.
And our medical.
Is
as
everybody
well.
crazy or is it me? Right.
Do you want us to answer that?
I know the answer. Okay, back to the serious business here. Thanks, Raleigh.
Yeah, I have one more slide unless, do you have anything else to add? Okay. And just some more 2023 data. Like I said, this is the last slide. But here we track what our PAC team does in terms of providing direct support during each encounter to our PAC clients. So what we're seeing on the left side is that peer support, engagement, psychosocial support, and or assistance were the top three supports that were provided to PAC clients, both who reported using substances and those who did not. So that's broken out. And then to the right, specifically, the team does also provide harm reduction services and education, including distributing Narcan, also known as naloxone, fentanyl test strips, providing health education, conducting substance use disorder assessments, things of that nature. Any other questions?
Oh, thank you.
Are fentanyl test strips something that are widely available?
So Pickens County Public Health, we have them and we can distribute them to our community. If there are opportunities that you see where we can place them, we do encourage that when we're handing out FTS, fentanyl test strips, that the individual also has Narcan on hand because fentanyl test strips are not foolproof, so.
Right, right. So every graduating high school senior should have a kit, I think.
Yeah.
Steve and then Kelly.
So do you work at all with Maggie Seldine on this? I mean, I
Yes.
presume you do, but I'm curious about
Yes, I
how
work
much
with
she
her.
gets up here into Pickens County at this point in time.
Yeah, so we've made some really great strides with Maggie and her team. So Hierarchy's Harm Reduction provides services at Valley once a month. They're on the second Thursday of each month. They provide services at the Health and Human Services building from 12 to 2, and then move over to the Buttermilk parking lot from 4 to 6 p.m. So they've been doing that for the past 2 to 3 months, and will continue throughout at least through December, hopefully longer. We might adjust some hours to ensure with the winter time. We just want to make sure that we're capturing everyone, but it's going really well.
Oh, good. Glad to hear that.
That's great that she's doing that. I taught her in 7th and 8th grade.
Oh.
I would not have predicted that that was where she was going to end up.
Yeah, she's great.
Okay, Kelly.
Yeah, I'm just wondering how your data integrates with.
Mike,
Sorry, how your data integrates with the coroner's data. Like, are we getting a full picture of harm along with?
Yeah,
the
that's a great
reduction?
idea. I'm curious, does Audrey?
I'm always curious about like what's going on. We don't get those reports really. Sometimes I drill them during budget, but not probably the best format for that.
The coroner has been really helpful in getting us de-identified data, but then they collect a whole lot more comprehensive situational information about what were the circumstances of someone's death, and for some of these accidental deaths, or we've been working around some suicides as well. We're able to collect additional data and then do our own analysis. And working with our coroner allows us to do that in a much more timely manner than waiting for that to get processed. And then there are dashboards that are available at the state level, but we really do thank them for making that available to us so that we can analyze that data in a much more timely manner, and then feed any information if we're seeing trends, feed that back into our programming.
And since you mentioned it, what is the prevalence of suicide relative to deaths in the county? And do we have a harm reduction program related to that?
I can look into that. We have some data that we pulled together around for mental health. We have a mental health RFP out right now for some strategic planning that I think has that data in it, and I just don't have it on the top of my head.
I'm curious. Thank you.
can I add to that?
Yeah, please.
Because that data would be, I think, really beneficial if it included where the people who do commit suicide, where they're from. Because, you know, we've had a history of people who come here because it's a beautiful place to die. And though they're not really our residents or our locals, they're people who are our visitors or our guests. And I think it would be important to separate that out, if they can. And I think they can. So.
It seems like mountain communities have a similar, it seems like the statistics are pretty similar in the high elevation, or maybe it's the party towns, or what, I'm not sure. We've talked about it for years. I don't know if there's ever a conclusion, but we know it's happening.
Well, and I feel like CDPHU is giving a lot more attention to like access to guns as relative to suicide prior to COVID, and I don't hear anything about that anymore, you know.
They've just picked up
Okay.
a campaign, so we shared a lot of the media they've developed for that this past, I think it was May.
Right, yeah.
June, thank you. And so we pushed some of that information out just for about a month. We had an event at the library, and really what we do find with suicides is guns are the leading cause of death, and then I can share the statistics as well. When we talk about gun safety, the Surgeon General has come out with some warnings there, as well as we've also got some local data that shows how accidental deaths for children. Guns are one of the number one causes there. And when you look across the board, the number one thing that we can do is just encourage folks to lock up any firearms. We had our first effort in putting that information out to the community this year. Dr. Kim Levin, our medical officer, wrote an op-ed, in June, to that degree. So the state has an office of firearm prevention or gun control. So they've started ramping
That's
up
great.
some of their support there as well.
Great.
Can I ask something about
Go ahead, please.
Do you have data correlating drug use and suicide in our valley?
I can.
Drug use and gun suicide, or just
Suicide and drug use.
They threw guns in there somewhere.
No guns. Not about guns. Just whether there's a relationship between mostly young people who choose suicide who are using drugs.
I can look, but I know specifically there is information about like the method. So we can show which suicide attempts were or suicide completions were due to drug overdoses.
Are you talking intentional overdose? I think I'm just looking at information that just says they had a level of drugs in their system. They would test for that. They always.
There's a lot of I think that the trouble when you start trying to drill down into data for just Pitkin County is because we are so small.
Yeah, for sure.
A lot of that data ends up getting suppressed.
Yeah, and plus you can't really make correlations when you have a small data pool.
Right. So if there are trends, we have an Office of Child Fatality. We have a Child Fatality Prevention System, which looks at child fatality. So if you're concerned with youth, all deaths of anyone 18 or younger, not only do we review that at a county level, but that gets rolled up at a state level, and then that data gets put together to look for trends as well. And so you'll see some trends in that data as well.
And we've also seen, and Greg and I have talked about this, the relationship between being part of the LGBTQ community and choosing suicide as a resolution.
Can I restate what I think your question was, though? Were you asking about the association between like a substance use disorder or issue or abuse with suicide?
Yes, I was.
With someone completing
Not necessarily
suicide.
was it drugs that killed.
Yeah,
But yeah, I
right,
was.
okay.
I think Jordana got that. Right.
Okay.
You knew I was asking that. Some kids who use drugs a lot, or not just kids, people who use drugs a lot and eventually end up committing suicide. That's the correlation I was asking about. Not necessarily did they die of an overdose. But.
I can look into that. You know,
might
that
be a tougher
we've got a
number.
lot of this data in a lot of different ways, and so depending on what we're trying to do or accomplish, we can go in and look at different levels and slices of the data, and then again at different levels. So at the local level, we probably wouldn't be able to find too much, but if there was interest at that, looking at a larger population level, there would be more data to look through.
That'd be great.
And then it's always understanding, you know, what are you trying to do with that data or information.
Okay. I'm looking at the clock, realizing that we get carried away. And you've got more people who want to talk.
Yeah,
So let's keep
we're going
this
to have
moving.
to extend, I think, our executive session
Perhaps.
to longer than 5 o'clock.
We'll see how we do.
Listen in the car.
Okay.
We have
Let's
some
keep
big
it moving.
issues.
Who's next?
I'm next.
Okay.
My name's Peter Mueller. I'm new to public health. I came from the RE1 school district where most recently I was the principal of Basalt High School. So I'm really excited about this
great.
new opportunity, and it's nice to
Thought you looked
Welcome.
familiar.
see all of you. So our STEP program is to help reduce the tobacco usage throughout Pitkin and Garfield counties. We have a partnership with Garfield County, and I've served both counties in that role. Our first kind of order of work, if you will, is to continue to collect valuable data. Right now we have 3 of 4 school districts using the Colorado Healthy Kids Survey, and that's an important touch point around youth and tobacco, among other issues related to student well-being. I'll continue to work with the school districts to ensure that that survey is used in 2025. The other piece is that as this became a very hot and heavy issue with vaping, as the vaping rates exploded 3 or 4 years ago. It seemed as a school principal, every day there was somebody in the bathroom vaping, and so one of the initial knee-jerk reactions was, let's hit them hard. And then as we matured as educators, we began taking a much more restorative approach to students who got into trouble. That's exactly what the state is advocating for. And so part of my job and Raleigh's job before me was to ensure that all our school districts are taking a restorative approach. It doesn't disqualify the idea of having consequences. It's really a consequences and education. And the last thing we want to do is just to send kids home when they get caught vaping, because that really just exacerbates the lack of connection to school, to community, to people that they trust.
And gives them more time to vape.
It does, yeah. Another piece here, let's see. Yeah, so, and the other piece is that school districts have policies, and those policies need to be rooted in this kind of idea of wraparound services. So throughout the 2 counties, as I mentioned, 4 different school districts need to make sure that all of those school districts have a set of policies that are reflective of providing services, education, not only to the students, but to the families and to the communities themselves. An important piece around equitable community and state interventions. For instance, our Second Chance Tobacco program that is delivered as an interactive tool to help students understand the dangers of tobacco use is only in English. And so the state has appropriated additional monies to begin in January to revamp the system of providing resources for students who are caught with for a tobacco infraction. That's part of that equitable desire to reach all students in a thoughtful manner. And then lastly, I just talked about reducing the health disparities throughout our populations. I think about that in terms of the family resource centers in particular. All 4 school districts have robust family resource centers, and it's just important that in my role that I help continue to support the collaboration between school districts, community family resource centers, and the state and the kinds of resources that we offer those communities. So as I mentioned 3 or 4 years ago, thank you, vaping was kind of a little bit of an epidemic, and it's important to note that just in looking at Aspen alone, if you look at that third graph, 30% of students had vaped in the last 30 days. So you think about 3 in 10 students were vaping, generally at school, just after school. And then importantly, 2021 to 2023, just that 2-year gap, the statistic went from 30% down to 17%. And so I think that there were a number of factors that where the use of tobacco exploded, and societally, counties, public health, school districts, all of these efforts have had an important impact on youth and reducing tobacco usage throughout the entire state. So
I was attributing that to Raleigh.
She scared them all out.
Yeah. As you should. That's right. So I think just if we go to the very next graph to the right of that, think it's wrong or very wrong for someone the same age to use an e-vapor product. So as the perception of harm increased, the usage decreased. And again, 75%, that's a huge number. So now we're talking about the majority, 3/4 of the student population know full well that vaping is not good for you.
It's not as cool as it used to be.
It's not as cool. So it got dangerous, it got addictive, it got expensive. And all of those things, along with education and people saying that is not cool, really has had a very positive effect throughout the entire state to reduce these numbers. We still have work to do, and that's important to note. Region 12 is still significantly above. Region 12 is Summit County, Pitkin, Garfield, is still, and Eagle is still significantly above the state. And so we're working to continue these efforts to reduce smoking, tobacco usage throughout
That's
our
been
region.
consistently higher. We've
Yeah.
been consistently higher for years, right?
I've always thought that was interesting when you look at the ranching communities. Not to say anything about cowboys, Francie, but maybe they just do chew more than vape or smoke.
That'd be included, though.
You do think of the
tobacco, is it
Marlboro
still
man, you
included?
know,
Yeah.
riding across.
Yeah.
Yeah. Who died of lung cancer, by the way.
It's harder to throw a lit cigarette off a horse these days.
Yeah, without burning down your
Without
pasture.
torching your own house. Right. Okay.
So this is, one of my favorite pictures from Basalt High School, just recent graduates declaring where they're going to school.
Fantastic.
And it kind of goes, a long way to talk about if you have a vision of where your students are going, if they have a vision of where they're going, they're going to be much more resilient and prone toward a successful pathway. So we're going to continue to do the work that Raleigh started. She had an incredible profile for the Pitkin County that she finished last fall. I'll continue to do those profiles for RE1, RE2, and Garfield 16. They really highlight the challenges and the opportunities and the things that are working. They're really they're not meant to be a gotcha. They're meant to be this is hard work, this is how we're working together, and this is what this can look like. As I mentioned, the Colorado Healthy Kids Survey, super important. We have 3 out of 4 school districts using it, and we'll push for all 4 in 2025. And then importantly, tobacco usage, I think of tobacco usage as like the tip of the iceberg or the point of the spear. Behind that is mental health, physical health, connection to school, a trusted adult, all of those things. And so when I am in conversations with superintendents, tobacco is just the entry point, and then it's about how are these other support entities and efforts going, and how can we help, as in Garfield and Public County Public Health, how can we support your efforts to support students and families? And I think, just lastly, we'll continue to work hand in hand with CDPHE, Colorado Department of Public Health and Environment, to make sure all these resources going forward are bilingual and accessible to a larger demographic than they currently are.
You must be really proud of all those kids coming out of your school.
MSU.
I know.
That's great.
It is
My
great.
niece went, my great niece went there. She loved it.
Very cool. Okay. Yes, and what else you got?
That's
That's
it.
it. Thank you.
That's
Great to meet you.
That's a
Yeah.
wrap.
Yeah, well done.
A little more history on Peter, though. He used to teach at CRMS, including my children.
And that's why he fled to the.
Basalt, they drove him away.
Your children did?
And her children, by the way, I loved all of them.
What else can you say at this table?
Okay, Kurt, you're up.
All right, I think I'm the last one here. FEP, Public Health Emergency Preparedness, Kurt Dahl, Environmental Health Manager. Carlin Porter is not here today. She's out of town. She administers this contract for us. It touches both the epidemiology and emergency preparedness and response team, as well as all of public health in terms of training for response to things like outbreaks, as we've all been through and know well at this point. So this contract we've had for a long time. It actually predates the public health department I think Patty mentioned Liz Stark. Liz Stark was responsible for this back when CHS was the public health agency. So this is a federal pass-through for funding that comes down from the CDC through the state health department and has minimum requirements for the department in terms of investigation of communicable disease, training around communicable disease, outbreak investigation, pandemic response, and education and training for both our own staff and then education for providers, the hospital, things like that, other partners that may be impacted by communicable disease. There are a number of things that I suspect over the years that you have all heard that we've done with activities. The piece that was really, I think, really cool this year that we don't have data to share right now, in part because what the state health department has is, or has in the past had is, I think it was 10 or 11 different disease reporting systems or illness reporting systems. So you had communicable disease, then you had a zoonotic disease one that was separate, you had one that was separate for lead. This year, the state has pulled together, it's called EpiTracks, which is a one system that we then report all of these things into this one system. So going forward, we should have then some data around this to start talking about what we do in terms of investigations for the different things that we investigate. So we're really excited to finally have that system all in one place. There are some pieces that are still coming in, TBDB, which is the tuberculosis one, that is still being incorporated into the system right now. Again, the contract really talks around data investigation, how we report that data, how we disseminate that data. You've probably heard our department talk about Hans, and that's not my cousin in Germany that we're talking about. It's an acronym, stands for Health Alert Network, which is, again, a communication system, goes back to the days of fax, and we still use fax for some places, for some departments, or providers and or email, but we have information that comes from the CDC that goes to the state health department, and then the state health department disseminates that to us. We then send that off to the hospital, local providers, potentially the schools, anyone that was within our system. We maintain the contacts, local contacts within that system to then put this information out to. So things like avian influenza, we've had a lot of information come around that. Consumer protection goes through Hans. We've had lead recalls around applesauce for children. We get that information and then we pass that on to, typically we have an indication of who we're supposed to pass that on to. So we're working towards making that fully electronic. We'd like to get away from fax, but we're still working with some folks on email systems and the privacy of email systems. So we have radio drills that we do with the state health department. So we have a couple of radios within the department for use for emergency response. And then we administer training. We most recently did one around rabies. So for the interdepartment and then the animal safety officers, both Snowmass Village, Aspen, and then Pickens County Sheriff's Office, where we just worked through a response on a rabies positive case, completely tabletop, but we do things like that with within our department. We're looking at doing one that's going to use computer systems that we had a little glitch earlier this year that will involve several of us to, again, walk through a tabletop exercise around emergency response. So that's tried to do that really quick, knowing we're
quick.
short on
Thank you.
time, but I know you've heard
Cranking
that one
through it.
before. But
Yeah, thank you. It's good to know. We hopefully will be prepared for whatever comes next.
All right, I'll give you a couple seconds on each. So we've got two MOUs that are in the process of getting signed. One is between the City of Aspen and Pickens County for opioid settlement funds. The desire is for the City of Aspen to transfer those funds to us so that we can spend them on approved strategies. The first is going to be to support the promotion of an anti-stigma campaign. And then the second MOU is between Eagle County and Pickens County for the provision of WIC, Women, Infant, and Children Services. So we've got it drafted. This is going to allow Eagle County to receive funds directly from the state to be able to deliver those WIC services to Pickens County residents. They provide services at the Algebel Community Center on a regular business hour basis, and then also come up to the HHS building in Aspen once a month. WIC serves about 50 clients in Pickens County every year. And this is a program where the funding is actually going to be decreasing for this program. So we'll probably be looking out to how we can help support Eagle County to continue delivering those services to Pitkin County residents. But we didn't share that the STEP tobacco funds will be increasing. So we're always doing that balance, and you'll hear more about that during budget time.
Great. Thank you. Questions? Comments?
Great job, you guys.
Thank you. Thanks for all that. A lot of information. Today's been an information-rich day.
Yeah, we're not done yet. We had Peacock
There's
next.
more to
Oh,
come.
my God.
All right. Well, thanks for letting us come and present today.
Nice
Good
to
see
see
you.
you.
all.
Yeah, thank you.
Thanks,
Thank
everyone,
you.
for
Thanks for
what you
coming in.
do.
Great to see you all.
Welcome to the county, Peter.
Get to go to
Thank you.
Crystal.
You're not going to take your grandkids
To Catalina. I'll hide a rock over there for you to bring the kids over there. In Catalina.
Oh, actually, we haven't been. We're supposed to go.
I gotta stand up.
I'm gonna follow that to the seasonal illness. Is there anything I
sing
can
on
immediately do
airplanes.
about rabies?
I just,
Want me to check?
no.
Oh, right, yeah, you're feeling it. Yeah.
So we don't have any presenters coming in, you're just telling us.
Oh, I can do this, yeah.
We have people
You wanna
coming in?
do it? Never.
Talking about their
Are we
nonprofit.
good? A couple minutes, are we good? Are we just going through?
You're already an exec or
I
something.
could ask John to just put this out.
Yeah, how that.
reconciling spreadsheets.
But this is just you catching us up on the people we've heard from, this update.
This
on
is us making a
progress.
decision.
Yeah, I know, but you're not bringing more people in. I mean, we're not bringing more people
We're done, listen, we're done with requests.
This is
Yeah.
making a decision time, Francis.
in. Yes, great. Finally,
Okay, so, let's.
whatever it is.
Sorry, John.
Yeah,
We are
John.
No,
terribly
that's,
behind.
that's okay. So we scheduled 45 minutes. We may or may not need it. I hope we don't.
I don't think we will.
But
I don't think we will.
so the board had budgeted $200,000 for capital-oriented grants in this year's budget. You've heard from a number of organizations. You should have a memo in your packet with a brief summary of what the requests are. We have not provided analysis or background. We're really relying on the board's impressions from the information that is presented by each of these entities. You heard from Habitat for Humanity back in June. They had a $2 million request on the table, really related to supporting their modular home facility that's being developed in Rifle, with the idea of pre-purchasing units that we could use at Phillips or other affordable housing projects. Epic, which used to be or still is BoCC's?
No,
or-
it's just it's a side arm of BoCC.
sidearm
basically.
of BoCC's came in on some of their programs related to youth and training. They had a request for $50,000 that came in front of you July 9th. English in Action was in front of you on July 23rd. They have and asked for $50,000 in 2024 and have asked for a commitment in 2025. That would be part of the presumably 2025 budget process at the board's direction. You heard from the Little Red Schoolhouse. I think you have largely addressed this request at this point, or at least have a process for that. And then Lift Up, who had requested, I believe, $200,000 towards their capital campaign. So that is all I was planning to give you, and provide an opportunity for the board to have conversations.
Great. Yeah, sure, go ahead.
What did you think about the Little Red Schoolhouse?
Yeah, that's what I was gonna say.
Was it, I don't think
Well,
we wrapped it up, but you said.
I'm not sure you wrapped it up. So there was a request of ARPA funds that was granted. The board gave $208,000 in ARPA. We're also working with our grant writer, DC Strategies. They only work with entities within certain geographic distances of one another, so you're not in a competitive environment. So we're using DC strategies to both research and provide grant writing assistance. And then my understanding, I wasn't at that meeting, but my understanding was the board would consider additional contributions to match depending on what the grant opportunities were.
Up to, I don't think we,
But do we know the grant opportunities?
No, we don't. That's why we want to bring those back to you.
I would be concerned that they might get a grant and we would commit to a matching, to help them with their matching funds, and it would be more than.
Maybe we put a limit on it.
Yeah, no.
It should be good for them to get a grant that was a lot, but, so maybe we could,
Match to a certain extent.
yeah, to 50.
Yeah, that would all have to come back to the board for consideration, I
So
think.
does that mean we can exclude consideration of the Little Red Schoolhouse right now?
I'll leave it up to you. If the board wanted to carve out part of that 200,000, just to hold them reserved for that
We have
purpose
200, right?
of 200,000, I'd say 250.
And we'll have another
200.
200,000 in January?
We haven't decided that
I
yet.
thought we
Haven't
had.
decided yet.
I
Well,
wondered.
it will be in the proposed budget. It was our intent to
Yeah.
bring that forward for the board, but it's up to the board to
Right,
appropriate.
I'd
Yeah.
love to propose that, because we've been talking to Habitat, and it seems like we're still, there's a lot going on with Habitat. Their asks are huge. We've got a new one on the table. I would propose that we just take this one off the table on, right now, today, and focus on the other four. You can, weigh in on whether you think that makes sense with the Little Red Schoolhouse or the others. But I was gonna say, just for purposes of discussion, what if we split that 200,000 four ways between those four, knowing we're gonna keep talking to Habitat? The other part of my recommendation is that I think these are really all incredibly valuable organizations that do a lot of work that we benefit from, or the community does, and that we might consider increasing our purse to distribute and support them, because they probably provide pretty good bang for the buck for us. And I'd like to have a conversation about that further down the road. But my proposal today is to do 50 each and call it good, keep us moving.
I can be really quick. Gail led me to believe that the modular place was on go.
Not a go?
Was on going. It was on its way. So, I mean, that would be a further discussion if we wanted to with Habitat. I agree with Greg, and I think I'm not ready to up the ante for next year. I think I need to see the budget. And we can't just keep continuing to take this out of our general fund. But I do also agree with you that we get a lot from these nonprofits that help reduce some of the workload for our own staff, or, for staff
Reduce the
throughout the
need for
valley.
staff, even.
Well, we haven't seen that yet either, Greg.
We're working in that direction.
Yeah. But I agree, and I would like English in Action to come back to us next year to see where they are in their fundraising. Their building is moving along. I was down there the other day. It's, all of a sudden, there's like a structure coming up
great.
out of the ground. It's pretty cool. So, yeah, I could split it up right now, but I want to hear from the rest. But Kelly's had her hand up patiently.
Okay. I'm waiting to wait. I think Habitat's request merits a thorough review and presentation. As I understand, they have, been very diligently working on their pro forma and with bond counsel, which is how I understand they want to raise some of this money, as well as through asking for money from the state. So I think we need to do more due diligence on any support for that.
But definitely worth
But I
it.
would, yeah, I'd like to. Related to the EPIC, I guess I'm fine to meet their $25,000 request. I'm a little hesitant about future requests, simply because I'm aware that CORE is doing an evaluation of some similar kind of workforce
Training.
analysis. So I don't know how they play into each other. So I'd like to understand that a little bit better and see if there's
Overlap. Yeah,
there's
we've
overlap
suggested that
or
to both of them.
synergy
Yeah,
or so maybe we kind of further that discussion before making a 2025 commitment.
You said,
to
oh, you
Epic.
said $25,000, but you meant
Yeah.
50. They've asked
No,
for,
no, I thought they asked for 25 now and 25 next year.
no, it's 50 now.
I see, okay. Well, I'm not I don't want to make a future promise yet.
Right, we won't do next year yet.
Barring, I think we have an opportunity to have some further conversation related to that. And I think I agree with John. I feel like the Little Red Schoolhouse, we've shown up with dollars and we've shown up with support, and there's a future conversation potentially to be had there, but not contingent upon deciding how the monies get sent out today.
So, what you're suggesting is that we remove Habitat and the Little Red Schoolhouse from discussion today?
That is what I'm suggesting, yeah, yep. And I would just note that if we can remove housing project money from the general fund, then we may have more space in the general fund by
Or we may
passing
just-
a
yeah.
mill levy this fall.
Yeah, well, I'm not suggesting moving more money anyway out of that. But, I gotta stick to my guns on something. Right.
Steve?
So, I would agree with not including Habitat in this 200,000. It seems like it's housing money that if we can pass the issue in November, I think that would be a ready source of funds for what, getting modular units from the Habitat factory and supporting it that way. That could also be where the money would come from for the 88 unit thing that they're looking at. Little Red Schoolhouse, I would take it off the table for now. It's a bigger request, but I think we kind of ironed that out, that we would help them work on getting grant money, and they've already gotten over 200,000 from us at this point anyhow. But I would support in the future helping them come up with more money, or maybe Pickens County puts in more money in future years. So that would leave the three groups with 200,000 to split up. And I would suggest putting 50,000 into Epic, 50,000 into English in Action, and 100,000 into Lift Up for this year to divvy up the 200,000.
Let me get to Francie if she wants to, or I'll go to Patty, your choice.
Well, I don't mind going up to 100,000 for Lift Up, but I don't want them to come back to us next year and ask for another million or what. I mean, I do think that Lift Up's needs are greater in other counties than ours, and so I would like to see more pressure on them.
Cost sharing.
Yeah, that. I'm certainly in favor of 50,000 for Epic and 50,000 for English in Action. I wouldn't mind going up a little bit for English in Action. I don't really know what their remaining needs are, though. So I'm kind of thinking we could leave 50,000 in there, and do 50,000 to each entity right now and leave 50,000 in there and carry it over to next year maybe, or I don't know. I'm not sure, but.
English in Action's total request is 100,000. So if you wanted to just
We can
address that, you
reevaluate
could
and
do
see
that.
what they're next year, though, when we decide, but, oh, wait, Francie, are you done?
I'm done.
Yeah, I would rather keep the 50,000 in the pot, because we did talk to Little Red Schoolhouse about maybe helping them with some matching funds. So, but we need to know what kind of grants, and we can, when they get a grant and they need a match of 20,000 or something, we would have that money to help them out. And that will be in the next year, probably, depending upon their grant. They are also reaching out to the grant writer with Northwest COG. So they've got a couple of grant writers out there looking for stuff for them. So I think chances are there'll be some matching funds needed for that project. And I think that would be a good opportunity for us. And, but I'm comfortable with spending 150 now and keeping 50 for that possibility. And then looking at English and Accent next year to see where they stand in their fundraising.
Kelly?
Yeah, I would like to just comment a little bit on your comment about Lift Up, because
About who needs it the most?
yeah, because it's the services that Lift Up provides is directly related to like a cost of living situation, which is driven by Pitkin County.
Yeah, that's true.
You know,
Yeah.
so people may be living, I mean, those could potentially be our economic services staff who
Yeah,
are, you
right.
know, living elsewhere.
I agree.
But, so.
I agree. I also appreciate their relationship with the farmers in the valley.
There's that, right. Okay, so where does that leave us?
Well, I'm not, I'm not sure. The last proposal that I heard was 50,000 English in Action, 50,000 to Epic, 50,000 to Lift Up, and then hold 50,000 for the Little Red Schoolhouse. But I wasn't sure if that was consensus or just the last thing I
It was
heard.
just Patty and I.
That was the last thing you heard.
As far as holding it just for Little Red, I think
Or
it'd be
just
great to
holding it.
have that in there. If they come in and they need 20,000, then or if we're not gonna go, if they need $100,000 of matching, we're not gonna, you know, so that would be a cap, but they may not even need 50,000.
So I think I'm hearing that from Patty and Francie, and so I guess the rest of the board.
So I think holding the 50,000 I'd be fine with that. And maybe part of that ends up going to the Little Red Schoolhouse, and then maybe there's some other that could go to one of the other groups either next year or to
We'll have
supplement
somebody-
additional.
Yeah, we'll have somebody else knocking on the door, I'm sure.
Yeah, you might have, it'll probably be you at
think I
this
have
point.
3.
Somebody new coming in, like desperate for trying to raise some money and needing matching funds and whatnot.
Well, I was in favor of my original proposal, or just doing Epic, English and Action, and Lift Up, and I love Steve's idea about giving Lift Up more. But since you've come back from that, I'll join you in that, which gives us at least 4 people who are somewhat in agreement.
Yeah, and maybe.
I'm agreeable.
You're agreeable. Okay, so
fairly
I think we thank you.
flexible about those.
Good, we got it done.
John, you got like 25 seconds longer. Is there anything else?
No, he doesn't.
done.
I'm taking it away
I
from him.
got it. Thank you all.
Okay, well we
I
got
will
that
still
done.
On
note,
time
we
and
haven't
under
really
budget.
created criteria for what we're
We haven't
approving
created
here. So,
We need to have that
you know,
discussion.
We need to
don't
have
even
that
have
discussion, and then we need to fund
I
it.
know, yeah.
Okay,
it, but they're 10 years old.
future agendas, other than tomorrow. I'm trying to look past tomorrow, and that's hard
Yeah,
enough.
really.
Yeah, I'll try and keep this short too. So, Accra Afternoon Blend is on September 19th. Patty, I think
Ticket.
we've got you signed. I think we've got you a ticket.
Could you tell me what that is?
They just do this every year. That's out at Buttermilk, and they just kind of bring people up to speed as to what's going on in the community. It's a big community event, and it's really fun.
They like forecast the winter and like what bookings they've
Yeah.
are made.
Do they serve wine?
Generally, they do. Or that. No,
Well, my last experience with
September
Accra and
19,
wine
what
was.
time?
I think it's Manhattan.
I'm
they
sorry.
serve.
It's September 19th, Buttermilk Lodge from 3 to 5:30.
They have good snacks, and they have door prizes that are pretty cool.
I would go to that.
You need to let Charlotte know to get you a ticket.
What day of the week is it?
And whether we're posting.
The 19th is a Thursday.
Thank you.
Probably not.
Thursday afternoon. It's at the base of Buttermilk, whatever that mountain lodge.
Suppose
at
as a
Bumps.
candidate, I should go to everything,
Bumps,
but I can't.
formerly known as.
Bumps.
I'm trying so many things right
And
now.
I-
it's just like-
John, do you have any other agenda?
I have open discussion, not future agendas.
I have one agenda that I'll let Charlotte know. I'm planning way ahead. I might not be here on Tuesday, October 15th, depends on travel. 'Cause I'll be gone that long weekend. It's a holiday weekend. So, it depends on if my boat comes in or my boat doesn't come in.
Play
And
the
my
lottery.
grandchildren are all on it, is the bigger if.
Got it. Okay, that's future agendas.
got
Board.
one
Oh,
more.
Steve's got one.
I suggest adding the RTCC Transportation Summit, which is September 12th, 9 o'clock to 3 o'clock at the Senior Center in Frisco. I will be there. Francie's going to try to be there. If we notice it, then other commissioners would be free to attend also.
I missed the beginning until you said my name. What was it you were
Well,
talking
it's
about?
the RTCC, the Regional Transportation
Oh.
Coordinating
In Frisco.
Committee Transportation
Right,
Summit.
okay. And where is it?
It's at the Senior Center in Frisco.
Oh, yeah, I remember now.
So if that was just noticed in our thing, then that would make it, enable other commissioners to go if they're able to. Greg has a RAFTA meeting that day, he wouldn't be able to go.
Is that the Eagle County Senior Center that's up by the Eagle County building?
It's in Summit County, in
Summit
Frisco,
County.
in Frisco.
Yeah.
So Charlotte's gonna notice the Acra thing as well, just
The
in
luncheon?
case.
I mean, the
Yeah.
blend?
The blend, on the 19th from 3 to 5:30,
What's the date of the one you were mentioning, Steve?
and then the other one is.
September 12th.
September 12th.
September 12th.
And we have to tell Charlotte if we need a ticket. I'd like
Yes,
to get,
yes.
I'd like to get a ticket to that.
Maybe.
It's a fun event.
In terms of October 15th, I will be in Jackson for the
That's right.
cast thing.
So it might be two of us that aren't here.
Supposed to be gone.
Ooh, I need to check, because that's our last day to present the proposed budget, so.
Oh,
we'll see if we're doing it
shucks.
before.
That boat is gonna be sailing around Catalina for days, I think. I'm probably, but I don't, I just wanna give you guys a heads up. You never know with traveling.
You never know, that's a long way offshore. You may not make it back.
26 miles across the sea
Exactly.
in a glass bottom boat.
Like Castaway. Okay, and that's future agendas. Have we got that covered?
Yes.
Yes, okay. Open discussion, I had one item. We were asked by Conservation Colorado if we would sign on to a letter to the, it's not the Oil and Gas Commission anymore. What is it called now? The Energy and Climate,
I think it's a good letter.
Something to disguise the fact that it's oil and gas.
well, it's actually the organization that regulates oil and gas. Are asking us to sign on a letter from them. I sent it to Charlotte. She was gonna
She sent
tag
it on,
you,
and I think it
John.
was it was a good letter, a good point.
So, do we have permission to sign on to there's a draft, which we can,
Unless you want to make any changes, but their points were all very clear,
Yeah.
I think.
yeah.
Yeah,
I don't know if you've all seen it, we okay? 'Cause that way, I think, because I think they need it pretty soon, so I would send
If
it
you see
tomorrow.
any tweaks, you can,
Do some minor tweaks, not change the substance too much.
we're going to trust you on this one.
Okay, so that's three of us agree, and the other two haven't said anything yet, but,
Oh, I'm just skimming it now.
Oh, okay.
I
Yeah, I looked at it.
I assume, yeah, I worried about a little bit, I mean, I don't worry, principally it makes sense, I just always wonder what the unintended consequences are to these kind of things.
That it'll get lost in the
Right.
mail.
well,
No, it's just like, like how do our friends in Broomfield feel?
well,
You know what
we're-
I mean,
yeah.
like those kind
We're
of,
definitely a county that is not hugely
so-
economically affected by it. We're affected by the being downwind of these things, but we don't have an entire workforce
Yeah.
or their funding.
I mean,
So-
I'm fine with it, I just,
But we also
know.
saw that at the CLEAR conference on last Thursday or whenever it was, the talk about how we really need to take care of those communities that, we're proposing that their source of extraction funding or whatever you call it. What do you call the funding you get from extract?
Excise, or it's
We'll think of it, extraction related.
The mineral fund fees that we get back? that-
Separation, anyway. So it is an issue and
It's an
everybody's working
acronym,
on
John,
that.
forget it. We're full of them.
But we
today.
also need to keep pushing for it to happen,
yeah,
right?
definitely.
So that's where I would be. Okay, I'm gonna, I
And,
think we've got,
poor communities of color shouldn't have to take all the burden.
exactly.
I'm fine with it.
Okay, thank you. I will, I'll have to work on that and try and get it out and get it signed. I'll work with Charlotte.
John looks very pensive. Is there any?
oh, sorry, I'm preparing for exec still.
Oh, our next,
No more open discussion?
any other open?
No, we do have open discussion once the board's done.
Okay, great.
I would like you all to consider letting me serve on the board of the River District. I've spoken with Laura. If she gets this judgeship, she cannot do it, and she's probably leaving the county. And I spoke to Andy and Zane, and Andy was quite thrilled at the possibility of my doing, and he would really like to have a commissioner rather than a lawyer on it.
I wonder why.
Which is what other counties have, so, yeah.
Kelly?
I'm fine with it. I would love for one of your agenda items for the board, the district, to change their rules about executive session and who they are allowed to invite in.
I
'Cause
agree.
it's BS if we can't invite our lawyer to sit at that table
Right,
in those
well,
conversations.
when I was serving as John's sort of backup,
Yeah.
I never got to go to anything. It was all
Yeah,
exec session.
it's
It was
just-
such a waste of my
So
time.
I think that's inappropriate.
Patty?
I am fine as an interim, Francie and I talked briefly, until we see what's happening in the attorney's office, and by chance, if we get an attorney to fill one of the spots who has a great deal of water experience, we might want to reconsider.
And we also have an election ahead of us, and you have election ahead of you. So it would be interim until we know
Well, we
what's
can always
happening.
reconsider.
We have our fingers crossed and all, but
Yeah, we can always reconsider.
We'll
That's,
revisit board appointments.
let's
in-
revisit,
Yeah.
let's
in
revisit
January,
that.
But for
so
now,
we need
like,
to do
yeah.
it for now.
They have their
Right.
big thing coming in October, and they
Yeah.
really want Pickens County at the table.
Yeah.
I also warned Francie to be careful. 'Cause
I'd
I
like to
think
know
the
what
The
they-
two gentlemen were extremely nice to her,
Right.
saying we would
right.
rather have a commissioner than a lawyer. And I'm thinking, because we had a lawyer who stood his ground as long as he could, so.
No, there's also an argument we could propose that Steve go in there because he's termed out. He has nothing to lose. He can play the tough guy.
So, you know, before I was commissioner, there was one point where our seat was open, and I asked to be considered to fill that, you know, be the Pickens County representative on the River District Board. But then at that point, it was decided to keep it in-house, and I think maybe Lisa or McDonald or somebody went for a while, and then John Ely started going. But a couple of years ago, Kathy Chandler Henry said to me at some meeting, "Why don't you be the Pickens County representative on the River District Board?" Which you know, John was firmly entrenched in there as our representative, but she was thinking it would be better to have a commissioner in there. Of course, now she will no longer be
She
there.
won't be
She's
there.
term limited.
She
but-
asked me the same
I
question.
But I
Having a
think
water
having a
attorney would be
commissioner,
critical.
the point being, I think having a commissioner really works well, and I think that would be well received by
They
the
would
River
love that.
District.
I think having a water attorney that's in-house is a better choice for us. But we'll
Well,
see how it
if we
goes.
get one,
We'll see how it goes.
Okay, so we're still thinking about it, but thank you for proposing it.
Well, I do have a procedural question. Do we need to do an interim appointment? Because right now, you know.
there's nobody.
Yeah,
What's
we
the-
won't do
what's the set-
appointments until January.
Yeah, we
What's
would
the
need
urgency?
to amend our,
So you all have a resolution that is adopted in January that appointed, I believe, John Ely. Now, I don't know if we.
yeah, Francie was the backup.
I
of-
think
I
you.
was-
We're the
So
backup.
you are actually, I think by that
You
resolution,
move
you
right
can
in.
step into
So
that
you may still be
role.
the backup, in which case that makes it
So
easy.
we can double check that resolution,
Yeah,
but if
okay.
you're,
What'd you ask
yeah,
us for?
if you're the alternate, then
I remember, I'm watching you.
Now, this conversation, you could have had this conversation offline with each of us, just to make it easier, but, you know, I appreciate you just
I did talk to
putting it
Patty
out
and
there.
Steve.
We talked.
Yeah.
I didn't get to
Okay.
you two.
One other item.
Go ahead.
At the CCI Mountain District meeting, I presented about the real estate transfer tax and the sustainable aviation fuel. And they both seem to be well received by the commissioners who were there. Afterwards, Kelly Flanagan, the executive director of CCI, came up to me and she's actually been, I think, thinking about this a lot, and she kind of asked my permission to go and visit with some people from United Airlines are apparently really looking at putting some money and effort into developing sustainable aviation fuel. I don't know if specifically in Colorado, but I said, yeah, go for it, go meet with them, but I think, you know, there could be some good things come out of collaboration with the industry on this, that it might not require state legislation to enable kind of incentives to and progress in getting the industry more entrenched here in Colorado. So just kind of a heads up that Kelly is working on that angle from where she is in Denver, and you know, maybe some good will come out of an industry connection on developing the industry here.
United touts that they lead the way in using sustainable aviation.
And they have the refinery in Los Angeles where they get most of their fuel. It's still at 1% or less, I think, of the fuel that they use.
But they, even then, the napkins they serve you with your free water has a thing about their use of sustainable aviation fuels.
Right, yeah.
At least
So it's
that's a napkin I got,
It's
ironically.
greenwashing for the time being, but it's a step in the right direction. I think it'd be great
Good
to
job, Steve.
conclude them in those conversations, but I also know we actually already have wheels turning in that
Yep.
direction, so
Yep.
can't hurt to have it all. Thanks, Steve. Kelly?
I would like for us to amicably request that the sheriff request reimbursement for recent expenses
Yes.
outlaid due to a visit by former President Trump for political purposes. And having seen no sort of community element to that, I want to see if there's support on this board to make that request.
Okay, can I agree, but I would like to know how the sheriff is paying that money.
So I think this is absorbed in several budgets. It's been our practice to, when we put together our incident management team and draw on resources, we account for those costs as part of our process. And in the past, we've billed the Secret Service for those costs and then distributed based on who made the expenditure.
Overtime and all that stuff. I'd
Yeah,
rather the
so
monies
for
go
us,
to.
it'd be overtime and staff
paying our
time,
deputies
maybe the same if we've drawn officers from Snowmass or Basalt. So it was a change in practice, and it's not all just Picking County's cost.
Right, and when we asked for it before, I think it was Clinton, maybe, it was from the Democratic Party side. And Joey the
Requested
sheriff,
before the event.
requested it, but I think it was paid by a private entity. It didn't come
I'd
out
heard
of the
that
DNC.
Hosts have paid for it in the past.
Yeah, so I think we should, I think we need to talk with the sheriff and encourage him to join us, or us to join him in asking.
Yeah,
power
there have been
should be.
different situations. I think we've gotten reimbursement through Secret Service in the past. I think this time they couched it as a mutual aid kind of request. I'm not sure if we get to make the same request back when we need help.
But I'm not
But,
sure it should be the Secret Service because it's a campaign. It should be his campaign.
No, but the president is always,
Yeah, they
ex-presidents
pick
are
up.
always covered by Secret Service.
I know they're
And
covered by
then-
Secret Service, but this was a campaign
What-
event.
With some events, with some fundraising events and such, it's also been the sponsor. So we can go back and look how we've
Yeah,
done
I
that.
think we, I
So
think we
do we
should,
have-
Kelly, thanks
I
for
just wanna-
bringing
We're
that up.
still checking to see if we have support. I've got two here who say yes,
Oh, yeah.
yes.
Definitely, but
Yes.
also
5 yeses.
sort of after the fact, somebody suggested that we put a boot on the on a jet at the airport and prevent him from leaving until the bill is.
I want to be clear. What I've
we wanted him to
proposed
leave.
is an
jet at our
ongoing, you
airport.
know, ongoing cooperation in the protection of past presidents and their visits to Aspen. But, you know, when they are for clearly partisan political purposes, I don't think that the taxpayers of Picking County need to put that.
And I don't want that jet parked in our airport.
I did receive a
Long
request
term.
from the newspaper for a comment from us on this very topic. I don't know if you did
No.
as well. Okay, so we'll have something to tell them.
It's nice not to be
It was
shared.
very strange that it was put out as a public notice the way it was. I couldn't understand that at all. I thought, what? I don't understand this. It looked like it was going to be about a rescue or something like that. And then I opened it up. I was like, oh my gosh.
And 50 cars it took to to drive them from the airport to North Star.
All that.
And
Okay.
I heard from Joey within minutes of that public notice going out, just so you know. And he explained how it worked in the past, that they billed first, got paid first.
Right. Well, FYI, just for
Well-
full disclosure, I had remembered the last time it happened, and that I thought we had been stiffed when Pence was here, and that we had a 50,000 plus bill that wasn't
That's
paid.
the one it was.
And I actually asked Michael, our sheriff, if that was the case. He said, yes, that's what happened last time. And so
But
I
there was
said,
one
well,
where we got paid back by the DNC, or it was a
previous,
private, it
that
was
would
a
have been
private
20
party.
years ago.
I mean, if you can afford
Yeah.
$500,000 to go have dinner,
Right.
I think maybe you can help pay back the county.
So it's I did propose that
On
he
either
serve
side
him
of the party.
when he was here.
Either party.
And that was before the event, so just so you all know. Okay.
That
One
something you
more-
will carry forward, or
Yeah,
you
yeah,
wish
we'll
us
carry
You'll
that
take that?
forward.
Okay.
And we had one open
glad you
discussion
thought.
item as staff, if we could do that.
And we also have
Unless
one
you-
more item on our agenda before we go to exec.
Yes.
And that was, go ahead.
So just real quick, Melissa, I invited here
Is this
to
our-
just make a kind of, I
Overview.
think, an exciting
High-level
announcement.
overview.
No, this is different.
Oh.
This is something different.
Got it.
new and a surprise.
So thank you, John. Melissa Knight, Director of Human Resources. So I'd like to share with you that Pickens County has just won a very special award in terms of well-being. So we just won the Health Links Champion of Well-Being Certified Leader Award. So this is an award that highlights organizations that have integrated interventions that address worker safety, health and well-being. So there was 58 organizations that we were up against nationally, and Lindsay Maurer, who works on the HR team, went down to Denver last week to accept the award, and it's a really big deal in terms of supporting well-being for our employees. So we are really excited on the HR team.
That's great.
Wow, congratulations.
Congratulations.
Thank Lindsay for
Yeah,
showing up,
congratulations.
May I
representing for us.
ask?
Patty,
Could you come to our regular meeting tomorrow and maybe make that more public announcement?
that'd be a really nice idea. Sure.
I think
At
it-
noon, right?
At noon, come at
Beginning,
noon.
at
Either
the
that or
very
come at
beginning.
Will
10
lunch be
o'clock, come at 10 o'clock when we're wrapping up, or noon, whichever one.
I'd say, let's do that at the outset, before Commissioner comment.
Yeah, I think that should be broadcast.
I agree.
Okay.
That's great news.
Thank you.
Thank you.
Well done.
Congratulations.
Thank you.
Well,
Yes.
so we should all be smiling.
Well, and
Yeah, but
now,
they changed Mindful Mondays to Tuesday, and it totally confused me.
It's no longer an illegal smile. It's legit.
all right.
That's great news. Okay,
I can
and
hear
then
it
what?
in my mind. So now it's just going like crazy.
And then I am here for open discussion, just to let you all know and summarize the recruitment process for the county attorney.
Do we want Rye to leave?
I don't think so. It's public. We're
This is a
public.
public.
It's supposed
Just
to be
making sure.
part-
I'm not sure if we're in exec session.
Quasi-public.
I thought we were going into exec session.
You will
so-
be after
Sorry,
this.
Rye,
This
I
is
love
the
you
high-level
dearly. So
overview.
glad you're here.
But leave the room.
So we're going to engage with Drew Gorgay, who is going to be a recruiting consultant for us, who has many years of experience in county attorney role and county manager roles across the state. The position will go live tomorrow. We'll do a national recruitment, so do a lot of advertising with the Colorado Bar Association, some government websites specifically for government jobs, ICMA as well. It'll close on September 19th, and then we will be back to you all in an exec session with applicants.
What about the National Association of Counties? If we're doing ICMA, we should do NACO. Don't you think? I have one thing I
Is that
forgot.
it? Are we done with that one? Yeah. That's it?
Unless you have
Okay,
any
so our
questions.
recruitment
But I
process
have
is
one
beginning.
thing,
Yeah.
part of that,
Okay.
and I meant to bring it up earlier. I wanted to ask the board if they would support having Jeffrey Woodruff come in as part of this, whether not to vote, but to be part of the process, since he will be working, sorry, Steve, you can stay. Since he will be working with whomever is appointed as county attorney, et cetera.
There's an issue that, yeah. I
Well, that,
remember
that there is actually a precedent for that because the board was in transition when I was hired, and both commissioner candidate and commissioner were involved in that process. There's an advantage to that. As candidates, we work for you all, and the candidate's going to want to know the perspective of the person that they'll be working for too. So there is an advantage for
Now,
candidates.
is there an
there.
issue regarding executive sessions and disclosure?
Well,
and
there's that
NDAs
stuff, too.
and-
I think we can
Maybe
invite him
Rye
in.
Rye
to
can
exec.
advise us on that.
Uh-oh, we're in trouble.
No, you guys can invite Jeffrey into your exec session. We'll just need to make it pretty clear about the limitations of that. So we can do that as we go into it, or.
And I assume the exec session would not include anything but that fairly narrow.
Right, it'd be the one topic.
Right, there's certain exec session topics we cannot invite them to, just because.
Historically,
You can invite
there
him.
are times when either a commissioner-elect has been included in exec sessions. That usually happens after the election that has taken place.
Right.
But that has happened in the past for certain issues that commissioner will be involved in.
That would make sense.
I remember that situation with me where I attended an executive session after the election. And I don't even remember what the topic was at this time, but it was appropriate that the commissioner-elect be there to be part of the education
Post-election.
and
Right. Pre-election, it's different. Post-election.
so since
Now,
Jeffrey,
pre-election, he can come in when we start the process. We can bring him in. It only takes.
You
Within
can
the
invite him in. It's just been a clear delineation that's happened in the past. Jeffrey is running unopposed, for one thing.
Right.
And two, you guys control that space to some extent. If you invite too many third parties in, it can destroy the privilege. But
Got
we
it. Now-
if we
right.
define that as we go into exec, then we can protect that as we do that.
Okay, and that he hasn't sworn an oath to the state or to the county or anything,
Not
doesn't
yet.
matter?
He hasn't. No, there's no requirement that anybody do that.
Okay, got it. Okay, just checking, because I
Oh,
thought I'd heard a couple
It's a
different
good
things.
thing to check on.
Great.
Being able to go into executive session's a privilege, for sure. It's not a right that we have.
And we want to make sure we do it properly.
That is correct.
Okay. With that, thank you for that. Is that anything, do we need anything else regarding
you all have any other
inviting
questions.
Jeffrey?
well, I thought for the public's benefit, I think the public should know that we considered several options. One option we actually considered was just appointing Rye Neely as our permanent county attorney. And I think all of us felt it was a better process to have us have a search and have other applicants that Rye could compete, against other attorneys who might be interested in the position. That just makes it a more open public process and gives the opportunity for, a search for, maybe some of the applicants might end up applying for deputy county attorney or assistant county attorney slots here also is one possibility. But it also would give an opportunity for the public to meet the candidates ahead of the appointment. And I think that's a healthier way to do it than just appointing. We all really like Rye, and we like the job you're doing, but I mean, it's a more transparent process to do it this way.
Yes.
Thanks, Steve. Okay, with having said that, let's move on. We're going to go back into exec session. So do we need, I guess we should, we're going to end our work session for the day. And thank you, Grassroots. Thanks, Melissa. And thanks to everyone else out there. And we'll be, I think we should take about a 5-minute break.
Okay.
Is that enough? And we'll meet upstairs again? Does that make sense? Got it. Okay,
Meet
thank you.
upstairs.
It's up to you.